Good morning and welcome to the County Commission work session for Tuesday, March 5th. And Mr. Administrator?
Good morning. We have, I think, 9 different departments that'll be presenting today and giving an update on their activities. And so without any further ado, I'll turn it over to Lourdes, and who's, or I guess Daisy, you're just going to hop right up because you're first.
Good morning.
Morning.
Daisy Rodriguez, Director of Human Services. Thank you for having us here this morning to provide you with some updates and some of our success stories for Human Services. So who we are, the department consists of 104 FTEs, and we have 7 service lines. And I'd like to introduce my team at this time, my administrative team. So for health services, we have Ms. Karen Yacham. Social services eligibility is Ms. Danielle Green. For veterans, we are currently recruiting for that position, and in the middle of that recruitment process, as we all know, Mr. Hill has retired. Congratulations to him. Under consumer justice, contracts and grants, we have Mr. Tim Burns. And under business services, we have Mr. Clark Scott. So thank you to them, who are truly the backbone, along with the rest of the staff who get the work done for us. So in our health program, it really consists of our Pinellas County Health Program, our PCHP, for indigent health care, and our health care for the homeless, which consists of the Bayside Clinic and the Mobile Medical Unit. The services that are provided are preventive and primary care, specialty care or referrals to specialty care services as the DOH clinical team deems appropriate, behavioral health services, referrals and screening, and when people screen for behavioral health need, a referral is made appropriately. We also have prescription medication services, so our clients are eligible to receive prescriptions. We have dental services at Bayside Clinic. We have co-located dental, 2 dental suites. And this year we added vision services so that people are in the community. We are doing screenings for vision services and follow-up for glasses as indicated. Our social services or eligibility team do exactly that. They determine eligibility for our health program. So people apply, they look at the various criteria to determine if they're eligible or not, and communicate with them as indicated. We do have staff that do disability advocacy for individuals who may think that they may have an SSI, SSDI claim. So we have a staff to help them facilitate that process. We have a staff that manage the Family Housing Assistance Program, so they work with homeless families to get them into housing. We partner a lot with community stakeholders and do a lot of presentations and outreach. Again, talking about who human services are and what are the services that we provide to the county. And we do a lot of connecting of the dots. We do a lot of resource guidance, if you will. Our veteran services, they work on optimizing benefits for veterans and dependents. They do a lot of education and outreach in the community. They provide resources and referrals. They coordinate with stakeholders and providers to meet the needs of the community, and we were designated a Purple Heart County. Our consumer protection investigate consumer complaints. They mediate investigations. They do a lot of outreach and education, and actually yesterday started Consumer Protection Week, so they're out there doing outreach and education to the community. And they do regulate and enforce ordinances. And our justice coordination team works as the liaison for the justice community. And part of what they do is to coordinate and help facilitate for justice for families, drug court, veterans treatment, the Juvenile Detention Alternatives Initiative, evening reporting, Public Safety Coordinating Council, and the Juvenile Justice Academy, which I understand is going to be starting this month again. And on that, a little bit later in the slides, they were very successful. The surveys on the Juvenile Justice Academy showed 100% satisfaction, and 100% of the time people would recommend it. So measuring the outcomes, we use a lot of tools to see how are we doing, what impact are we having. So we use scorecards, logic models, dashboards, and it's shared not only at the executive level team or the administrative team, but we also share it at staff meetings. We think it's really important for the staff to recognize the work that they're doing and how it plays along the service lines in human services, and ultimately how our work rolls up into the desires and the direction of the board.
And if I could just kind of highlight
Sure.
that, because I got to see that yesterday, and kind of their team in action, Lourdes was actually holding that with, and how they were using information and data to step back and analyze their programs, find efficiencies, find ways of connecting people with services, was truly remarkable. They really do a good job with this. You know, I've talked about areas where this is an area I think we have opportunities to improve, and they're knocking it out of the park. They really have their hands around it, and so, you know, kudos to you guys. But I wanted the commission to know how they use, it's not just sitting back and running these programs, but using the information and data, you know, gathering and a variety of tools that they use to make sure they're effective and efficient in connecting people with programs and actually creating outcomes, you know, that improve people's lives. So this is a real important area, and I just wanted to give them a big kudos.
Thank you. Thank you. So things that we've done, we have 190 plus contracts. As I said, we worked around enhanced program and fiscal accountability. So thank you again, Barry. We look at the data and we look at our outcomes, and where we need to tweak and make changes to programs to make it more effective and more efficient, then we go ahead and make those recommendations, and we do that. We have over 50 provider dashboards at this point, and we also do internal review, not only of the outside programs, but how we're working internally as well. The other thing that we do is strategic planning sessions, and we do that on a department level. Again, we share that. It's the ELT that starts it, and then we bring in management staff, and then ultimately we bring in lay-level staff to help contribute and also understand what our goals, strategies, we determine who the champions are, and we determine timelines. And we review that on a quarterly basis with all staff. So some of the things that we've done in conjunction with the Department of Health, our pharmacy savings. So this year we were able to save $1 million in pharmacy costs. We also look at what's clinically pertinent, what's our clinically pertinent formulary, what do we need to have on our formulary, and what doesn't need to be there. And I think one of the biggest things that we saw was an ongoing review of off-label use of medications. So what we found is that some people are very resourceful, and if they can't get a medication that might give them a buzz, they'll find a different medication that might do the same thing. So we discovered that there's a medication by the name of gabapentin that's for seizures and for diabetic neuropathy. But folks were getting them because I understand that it had a black market or off-label use. And we looked at that utilization, and so we tweaked that, and now there are very specific diagnoses under which our formulary will pay for that medication. So it's an asset to the community to be able to stop some of that. In our home health, we came in under budget again, and again, looking at the clinically pertinent level of services. We increased dental services. Our Healthcare for the Homeless program, we just submitted our uniform data systems report to HRSA, so we met our target for this year. We received a quality award of $122,000. We met or exceeded our clinical measures with the exception of flu vaccine. That's still always a challenging one. And one of the things we took on this year was to look at our no-show rate in the Healthcare for the Homeless. So we put in some processes in place, shared some appointment data, and we saw a decrease of 4% in our no-show rate for the Healthcare for the Homeless. The other thing I'll bring up is the e-application. In December 2017, we launched the e-app. So it's the online application for our healthcare program. And I say that to say that it helps to expand services to the community. We received our 10,000th application via email on a Friday in December at 2:48 a.m. And so the team then works that, yeah. So people can, they can apply anytime, anywhere from home. Our veteran services had an increase in unique clients served, 28% increase in the total number of services, again, increase in outreach, contacts, and public education. At the jail pod, they were able to see and work, excuse me, work with more individuals. We talked about the designated Purple Heart, and they continue to have ongoing participation in the Veteran Service Advisory Boards. And May 1st, we're going to be launching our Veterans Coalition meeting. We're going to bring together veteran service organizations to discuss the issues in veteran communities. So we have sent out a save the date. I have been able to secure Dr., I want to say his name is Carano, I may be saying it wrong, from Bay Pines. They're doing a lot of work around veteran suicide at the VA. So he's going to come in and talk to us about that.
Madam Chair,
Yes.
may I interrupt you just for a moment, Daisy, to ask you, is that the only piece of the suicide issue that you're looking at? Because my understanding from Dr. Chow is that it's just, really frightening to think of how many incidents we have of that in our teenagers.
So there is a system of care that's working on, the behavioral health system of care is working on a suicide initiative that has a lot of stakeholders around the community. We will be working also, I've contacted DCF, so I have a call actually coming up with DCF to see what their work they're doing on suicide as well. So,
really
no,
be
it's on the broader issue, yes.
I'd really be interested in feedback, what you find out
Okay.
when you start
Sure,
doing your due diligence. Thank you.
thank you. Consumer protection last year had 112 community events with over 3,000 attendees. Over 10,000 resources and materials were provided. They received 1,100 complaints. Their restitution and refund was over $1 million. And they collaborate with law enforcement and the contractor licensing to accept and investigate criminal cases or those cases that might have consumer harm. And they were also out in the community providing information on potential scams during the federal shutdown. So they were launched immediately. Justice coordination, I have here that it's 4 new grants. It's actually, I'm being very positive. It was 2 new grants that were awarded and 2 that are in the pipeline. So positive vibes there. On the Justice Academy, again, they had 32 participants, 100% satisfaction, 100% of the time people would recommend it. With the Evening Reporting Center, the program enrollment, it has ebbed and flowed a little bit. I understand that there were some criteria changes at some point during the summer, and it seems to have made an impact. The program reached a total of 9 concurrent youth in October. Our next steps would be to work with the JDAI committee, agreed to extend the agreement with PERC through September of 2019, and ultimately to have DJJ to procure and administer ERC in North and South County.
Can I ask a question on that, Madam Chair?
Sure.
I was trying to hold my questions. You got so much great information in your presentation. But just on the ERC, how much is left from our initial appropriation from the county?
I don't have that. I could get that for you.
Okay, if you could.
Sure.
Thank you.
Somebody take a note on that? Thank you. So I'm happy to report that we have a great grants team. We have $15 million in grants currently. This is a list of them, but I did want to highlight 1, 2, 3, 4. The 4th one down is a substance use disorder mental health grant. That's a new grant. And that is a pilot that we're working with Baycare Mental Health and Operation PAR. These are ER admissions from St. Anthony with a direct warm handoff to either Baycare or Operation PAR to help get them into care immediately out of the emergency room. The other one I'd like to highlight is our assistant outpatient treatment, the second from the bottom. This is also a new grant. We plan to serve 375 individuals over the course of 4 years. This is also for individuals who do not meet the inpatient criteria for involuntary placement.
Yes.
Thank you, Madam Chair. On the new grant that you got, how many people is that projected to serve?
375. 75 in the first year and 100 each year thereafter.
And is Baycare adding any, I know they got a program where they're using their LIP money with PAR, but I think that's more deep end. But are they contributing at all? Are they part of the partner and match money?
I would need to get that. I don't know offhand.
And whoever the match is, if there's a match,
Okay.
I'd be interested in.
Okay.
Thank you. Oh, one more question. So, we're using that grant money for the ER, to get people out of the ER. But when we put somebody in, I guess my question is, why aren't we doing it with the people going in the jail? Because in the jail, we're only keeping them there for up to 6 hours, and we want them released on the street before they go into withdrawals. Now, PAR is going in there, but we're releasing them before they go into withdrawals, so when we release them on the street, now they're going into withdrawals where they're not in a safety place. And why would we maybe not have used that grant for those folks and put them into a treatment where they can go through withdrawals safely?
I
So
don't-
that's another question
Okay.
I'm curious about as to why we pick St. Anthony's to get them out of the ER. I get that. It saves St. Anthony's a lot of money. But my question is, if we're releasing them out of the jail within 6 hours before they go through withdrawals, why are we not working on that vulnerable population?
So I can explore that a little bit further and get back with you on that?
Thank you, I appreciate
Okay.
it.
The opioid task force, this is another grant that we received for $999,000 over a period of 36 months, working in conjunction with the Department of Health opioid task force currently. And its objectives is to support the 5 goals of the opioid task force, plan and implement comprehensive programs in response to the growing epidemic, develop a county strategic information partnership, provide real-time and timely data and integration to portray a comprehensive landscape of the current state, to improve communication and targeted outreach, and to create cross-system planning and data evaluation. And we have a phase 1 with a final draft that is due at the end of this month. So March will be going into the phase 1, which is expanding some of the efforts with GIS and seeing where those avenues lie.
Excuse me, Madam Chair. Since we're talking about opioids, it seems to me it might be a good time to get an update, Madam County Attorney, on our litigation that we have going forward.
That is something that I can speak with you about each individually, I think would be better. The caution being that there are a lot of confidentiality orders at play in that litigation, so I think it's best that I brief you one-on-one.
I think that'd be great, because it's been a while since we've heard what the status is.
Madam Chair, can I know this is out of left field and not associated with this, but the calls I'm getting from people who have, their family members have overdosed or tried to commit suicide, more than ever before, I'm getting calls where people were overdosing on Xanax. They would take a whole bottle of Xanax plus something else. And the state doesn't require doctors to put on the PDMP psychotropic medication like Prozac or Xanax or something like that. And I don't know if we could collect data on the number of people that are overdosing in a combination with Xanax and Prozac and those other medications that any doctor can prescribe. And I think it's worth writing a letter to the state, if the data is there, to include medications like Xanax and Prozac to be included on the PDMP, because the last 3 people that I've had to help get into treatment, all 3 of them overdosed with Xanax. And you can get Xanax pretty much anywhere, and all 3 of these people were doctor shopping for Xanax. And they were going through a bottle of 90 pills in 4 days. So I think that's another one that's connected with the opiates. I don't know if anyone's collecting that data, if there's any way we could collect that data on overdose.
We'll take a look and see.
I think that would be something that would be worth writing a letter to the legislature on. Anyways, thank you.
It occurs to me that we might have that data from Dr. Thogmartin when he
I was
does
thinking
his
that-
report. So maybe you could send a note to him and ask him if he has that data to bring it when he comes to do our update.
I thought about that, but I think the 2 issues are different. One is getting into treatment, those that are overdosing, and the other would be deaths. So we can certainly,
Right.
Dr. Thogmartin, as medical examiner, would have those statistics for
Yeah,
people who die.
And staff can reach out to both.
I mean, he comes and he's got a whole list of the causes, so I'm sure that'll be in there if we ask him for it. Thank you.
And we'll also explore how we might be able to get that information and get back with you.
Thank you.
So again, we're always looking for grant opportunities to help support the ongoing efforts. So the empowerment team continues to do really well. This is a report as of December. I think one of the highlights is that there has been successful engagement with the clients. So out of the 33 originally, 29 were still currently enrolled. 21 were compliant with long-acting injectables out of 24 who have been prescribed long-acting injectables. There are a lot of client connections to different resources. The majority of those individuals are somehow housed. And we have been able to connect 16 of them to Medicaid benefits and 13 of them to our PCHP Blue Card. Leveraging some of the lessons learned from PSAT, we went ahead and launched the Pinellas Integrated Care Alliance. It's a partnership between Human Services, the Sheriff's Office, and CFBHN. There's joint steering committee oversight from these three organizations. It is a pilot integrated case management model to help high-need residents maintain stability in the community. So these are the folks that law enforcement, Pinellas law enforcement, are coming into contact with because their mental health unit, they're making a lot of phone calls. And so now, when they identify one of those individuals, excuse me, when they identify those individuals, they reach out directly to the PIC team, and the PIC team goes and finds the individuals and works with them and helps coordinate and link them to services. So it provides case management through a coordinated team approach. As of December, there were 130 referrals and 88 people have been enrolled into the program already. And here, just recently, over the last 2 months or so, we also started talking about the marching data, recognizing that this is a priority of the board. So we were able to get the data from CFBHN, and we have been doing some site visits to other receiving facilities and have some other ones coming up.
Could you tell me what the blue card is?
Oh, sure, that's the Pinellas County, I don't want to call it insurance card, but the
Right.
health coverage card,
Okay,
okay?
thanks.
Under homeless services, so our family, FHAP, Family Housing Assistance Program, again, this is FY18. There were 145 families supported, and we had 82 families newly housed. Deployed rapid rehousing through our collaborative with St. Vincent de Paul and the City of St. Petersburg. Again, this is FY18. There were 580 people served, 187 families enrolled, and 136 families were housed. Under the LIFT program, which are individuals who are in shelter and maybe just need that extra deposit, that extra financial help to get them out of homelessness into an apartment, that's what LIFT does. And for FY18, there were 82, it says families, but there were 82 cases. The emergency shelter bridge housing, which was a decision package that you all approved. So currently, it's underway. The contracts have been executed. There's a proposal for 60 families. It's new beds for 60 families over a period of 10 months. And then the homeless diversion was to hire some diversion specialists to keep people from entering the system. And so currently, there's one person dedicated to Safe Harbor, and I understand that that person has been onboarded and is, if not started already, is projected to start very soon. There's one person, another diversion specialist, who will be mobile, so they'll be moving around the county, and that individual is in the onboarding process currently. And there's another individual, another housing specialist, diversion specialist, who is funded by the Foundation for Healthy St. Pete, is already on board, and that individual will be working the City of St. Petersburg area. And then on our age-friendly, we had, and I know I'll be doing a presentation at the workshop on Thursday with a little bit more detail, but over the last couple of years, it was a 2-year project. We had quarterly meetings with the department champions. We completed our age-friendly action plan. It's in its final draft for your review and approval. We participated in the Fall Prevention Symposium in collaboration with Emergency Management, Department of Health, and other community stakeholders. And we're also a co-facilitator with the Area Agency on Aging for food insecurity among seniors with key community stakeholders. And some of those stakeholders are DCF, Tampa Bay Network to End Hunger, Neighborly, and 211, just to name a few. And then just to highlight a few other things that we do. So internally, we're always working on emergency management. We're always talking about preparedness. We did that as part of our in-service this past, on February 18th. There is a group that meets at least on a monthly basis, and we're starting to do a lot of coordination with Kathy Perkins around that as well. In regards to clinical, we make sure that all of our EHRs, our electronic health records, that it's up to date, it's on the current version, and that the physicians have the appropriate access to it. We participated last year in Pinellas Citizens University, and we'll be participating again this year, as well as the Point in Time. And one of the other things I wanted to highlight, also recognizing the importance discussed at this board, is the issue of human trafficking. And so in February, there was a workshop at St. Petersburg College, and some staff participated there. We also included, we had a guest speaker come to talk about human trafficking at our in-service day, because we have to start talking about it in order to make a change around that. And I've made some contacts, both with the DJJ, with the City of St. Petersburg, and other community stakeholders, to come and do a presentation at our quarterly Human Services Network Coalition meeting. So that's being planned for either September or in conjunction with human trafficking in January. And so thank you. Take any questions.
I had a question. You mentioned increased dental services. Could you describe what we're doing? Or
Well, I think that part of that was the access at the Bayside and at the Bayside Clinic. Prior to that, our goal had been, or we had been seeing about 200 to 300 clients for dental services, and since we opened those, we had 766 at last count.
Wow.
And I understand that there was a decision package some years ago, or so many years ago, on community dental. And so there's a community dental team that goes to Tarpon Springs as well. And
So we still have the funding for the roving team that
Yeah.
goes around to
Yes,
the free clinics and
Yes.
helps out?
yes.
Yeah, okay, great. Anyone else?
Madam Chair, just a couple quick ones. Thank you, Daisy. Just the breadth of what y'all do is amazing, and as Barry said to start off, y'all just do a tremendous job, just so I want to thank y'all. If we can go to slide 12, I have a quick comment on that one. I know Commissioner Eggers is out sick, but I'm sure he's watching somewhere, and I'm sure he's elated about what you're doing with veterans and the suicide issue as well. I just wanted to mention that. On the previous slide, you mentioned $1 million in savings. You just mentioned that casually. We're saving $1 million in pharmacy, and I just wanted to, so what's our total spend on pharmacy after that $1 million savings?
I would
Do
say
you have
it's
that?
just about $5 million, just
Okay.
shy of $5 million.
And is the sheriff able to benefit in the same way that you are in lowering drug costs for his medical?
I'm not familiar, I don't know.
Okay, I hope we'd have that conversation at some point
Okay.
with the sheriff.
Okay.
But again, thank you for the great presentation. One other question at the bottom, you mentioned 10,000 e-applications, and then you mentioned an email. So are they emailing in, or are they using an online?
I'm sorry,
Okay.
they use the e-app,
Okay.
and it comes into our central email or
Okay.
email box, our e-app box.
Okay, so it's
And
an
then
application
It
to
is
you.
an application, yes, sir.
And that's just on our regular website?
That's just on our regular website.
great.
And some of the partner agencies, I mean, they could do it, again, people could do it anywhere, a library, a home, 2 o'clock in the morning, 3 o'clock in the morning, but some of our community partners also have facilitated helping clients enroll or apply through the e-app.
All right, thank you so much.
Madam Chair?
Yes.
I just wanted to take this opportunity to thank, really, a heartfelt thanks to Lourdes and to you, Daisy, and your team, because not a lot of people have a real sense of urgency anymore when there's an issue, and I have found that if you make a phone call or send a text or an email to any one of this team, it's almost instantaneous that you get a response, and they've solved the issue. So I just couldn't be more impressed. Thank you very much for
Thank
your
you.
hard work. I know the issues they're tough to deal with.
Thank you, we appreciate that.
You're welcome.
Well, it's been said, but it truly is amazing, the breadth and the depth of work that you all do and the quality that is provided to our citizens who are desperately in need. So thank you
you.
so much.
Thank you.
They're touching lives every day.
Now we have lives, and now we go to animals. And
Oh,
Doug is
boy.
up.
Can't wait for this one.
Good morning, Doug.
Good morning, Commissioners, Administrator. Doug Brightwell, Director for Pinellas County Animal Services. As you know, probably, we are at 58 full-time employees. We have 2.7% of the workforce for the county. We do 5 focus areas. We have our enforcement, customer services, our kennel operations, veterinary services, and of course, emergency services to support emergency management with the SF-17 efforts. My crew, my staff here today, James McGill, who's my enforcement manager, Rusty Walker, who is my shelter manager, and Sandra Singletary, who is my administrative manager. They are the ones who do all the hard work with their staff, and they keep us all working very hard and keep us on point.
Madam Chair, may I interrupt just quickly?
Yes, sir.
Is this a new logo on the shirts?
It's probably about 4 years old now. Communications
Get outta
designed
here.
it for us.
Okay. We
We felt the need to have a positive brand
need
for
to get
the
a close-up
adoption.
on that.
I can't see it from here.
We can't ask them to jump up on the overhead. but-
Aaron?
I don't,
Very
Thank you.
colorful.
we will have to find
Okay.
communications to get, we'll email you.
Thank you, Madam Chair.
It's on the last slide.
Last one? Okay.
What we do, we are the only county open admission shelter. SPCA Tampa Bay is a private open admission shelter who only does owner surrenders, and we do all of the stray and sick and injured animals here in the county. We run a large pet adoption program. We take in all the stray and found animals. We take in all the sick and injured dogs and cats in the county. We run the licensing program, the rabies control program, permitting for a number of different areas, pet dealers, hobby breeders, guard dogs, dangerous dogs. We also have a number of community initiatives, and of course, enforcement takes care of the complaints and the citizen issues. Strategically, we are working to continually lower our animal intake. We are on a trend as a county with our nonprofit partners at a 5-year decrease in animal intake, and we hope to continue that through all the efforts and the initiatives that we're working together on. For our agency, we give community grants. We have a number of community initiatives out to help low-income citizens, and we work hard to resolve complaints and issues from our citizens. We also try to save every adoptable and healthy animal. We try to get as many as we can returned back to their owners. Licensing and vaccine compliance, which is a state requirement and a county requirement, is also the best way to get those animals back home. Microchipping is strongly encouraged because that is the guaranteed way with a registered microchip to get those animals back home. We work with 107 rescues and 5 community partners on our initiatives and programs. And of course, we do have our extraordinary adoption programs. As you can see from this slide, along with 5 years of decrease in intake, we have a 5-year trend positively of live release of our animals. Our dogs are this year ended at just over 81% live release rate, and our cats ended at just under 60% live release rate. And the lower the intake, you have to work a lot harder to get more and more of those animals released alive because many of them are sick or injured. So we're doing things we've never done in the past to get these animals into new homes, excuse me.
That's fantastic.
Our community grants program, we awarded grants through our Animal Welfare Trust Fund, which is strictly donation-based. It is not county funds. And we funded 10 nonprofit agencies for a total of about $66,000 last year. And they sterilized over 1,000 pets, vaccinated almost 200 animals. And those are all citizens, animals who are economically disadvantaged and would not be able to get those services provided otherwise. They have to meet certain financial requirements to qualify for that assistance. Our Veterans Aid Program is again trust fund based through donations. We have 5 county veterinary offices who are participating in this program with us, and Veteran Services assists us in handing out those certificates for qualification to our low-income veterans. We assisted 26 veterans last year. It was our pilot program year. And again, we provided sterilization and vaccine services for those veterans. Our pet reunification rate, is always a struggle because many of the animals that come in do not have microchips and do not have licenses. But the ones who go home all leave with a microchip and they all leave with a license. This past year, our dog our return to owner rate was almost 40%, and which is above the national average. And our cat live release, reunification rate was at 4.5%, which is just above the national rate as well. After Hurricane Michael hit Bay County, we deployed 3 teams of folks up there. They spent 11 days in Bay County. They assisted with disaster recovery, animal rescue response in the field, citizen rescue and assistance in the field, and they also helped reorganize and relocate their 4 pet-friendly shelters into better locations, because when we got there, some of their animals were outside and the people were inside. They didn't have foods coordinated for the animals, so we had to go in and help them get all of that set up and assisted. And we had that done within the first 2 to 3 days. And as a matter of fact, one of our staff who went just won Employee of the Year from the Florida Animal Control Association for her participation in this event. All right, for the enforcement side, we do a good number of investigations. We do all animal bite reporting and quarantine. We do dangerous dog investigations. Our animal control officers, on top of answering citizens' calls, they answer all the law enforcement calls from the 22 different cities in the county. They assist the law enforcement with Baker acting. If the folks are even Baker acted, we go pick up the pets, we bring them in, and then customer service tries to assist with getting some assistance to get those pets back out of our shelter to the family members. We assist several times a month with law enforcement for deaths and suicide responses, because many times our officers have to go in first and remove the animal before law enforcement or emergency workers can go in. We also respond to numerous calls daily and after hours for sick and injured animals around the county. Last year we did 2,129 bite reports. That is where an animal has bitten and injured a human, and we are required to document that and ensure that the animal is properly quarantined and vaccinated afterwards. We also did 113 dangerous dog investigations where somebody or an animal or a person was severely injured, and we currently have 16 dangerous dogs registered in the county.
16, you said?
16, yes, ma'am. We try to, luckily we stay below 20. We don't want to get too many going on out there. We do education outreach throughout the county through speakers events, on responsible pet ownership, licensing, and any other coyotes, wildlife, whatever they want to talk to us about, we will go out and do the education on that. We do at least quarterly Facebook Live series, and that is usually a seasonal topic. We'll be doing one shortly with hurricane season approaching. We do licensing throughout the year. We do anti-tethering, and it's a good 10-minute clip on Facebook, and we get a good response and do question and answers from the community. Also, just for ESF 17 emergency response, we are capable to operate 3 to 4 pet-friendly shelters, and they're all moving to new, larger locations this year. After Irma's experience, we knew that we needed more space, and emergency management has coordinated that very well for us. Our volunteer program is, I think, the second largest in the county. Last year we had just under 59,000 volunteer hours accrued, equivalent to 28 FTEs. If we didn't have our volunteers, our animals would not receive the activity and the enrichment and the positive interactions that they receive without our volunteers. We also receive pet food donation from the communities and our pet store partners. We put all of that food back out into a pet bank for citizens who would otherwise not be able to get pet food. This last year, we distributed over 11,000 pounds of dry food and 2,500 cans of canned food for pet owners.
Did somebody actually give you a half a can of cat food?
Well, we don't use anything that's unopened, but they will bring in various types of things. We only use the sealed foods. We have 123 individual foster homes, and last year those foster homes fostered just over 1,200 fostered animals, mostly kittens or puppies, to get them old enough to go back into the adoption program. Our medical department, we are getting prepared for kitten season, which is quickly approaching. Kitten season runs April late March, early April through October. We see a 50% increase in cats, and that is almost all kittens. So it doubles our workload for medical treatment, surgeries, housing, fostering. Everything doubles during kitten season because they have to be 8 weeks of age and healthy to adopt, and the majority of them come in anywhere from newborns up to 8 weeks of age, and we have to work accordingly on that. We take care of all, as I said before, all the sick and injured dogs and cats in the county that we get calls on that are strays. In our shelter, we hold a weekly rabies clinic for the public. We give vaccines, issue county licenses, and implant microchips. We averaged over 100 clients served every Thursday in 3 hours. It's organized chaos. Our surgical sterilization, we provide sterilization for all of our adoption animals before it leaves, all of our animals that go to rescue before they leave, and a good number of citizens who are picking up their stray animals, we incentivize them to go ahead and get them sterilized with us before they leave so that hopefully it will reduce their chances of coming back. We also do other surgeries as needed to get animals to be adoptable, such as eye surgeries, ear surgeries, amputations, and wound repair to get those animals adoptable. Our Vets Adopt Pets partnership, we do free adoptions, 2 per year per veteran or veteran's family. As you can see, in the last 3 years since we started the program, we're up to 144 veteran adoptions this past year. We still have our community doghouse program, where if we go out on complaints for a citizen not having proper housing for their dog, if they're otherwise fairly responsible pet owners and they're willing to work with us to get compliant on all of our ordinances, we will give them a free doghouse, again funded through our trust fund through donations, and then we do follow up with them to make sure that they're still staying compliant with all the requirements of the county ordinances. And so far, I think we've given out almost 30 doghouses in the last couple of years. But those are animals that otherwise may have been surrendered to us or turned loose because of not wanting to have to get cited for violations. Our facility, we are currently expanding our cat adoption room. We're reorganizing some of our administrative space to turn into cat adoption space. And we are working with real estate management on an evaluation of our dog and cat housing buildings because of climate control issues and some other issues with that. So we're in the process of those. We do have several age-friendly initiatives in partnership with Health and Human Services to make adoption and other programs as accessible as possible for those folks of a certain age. We do rabies licensing and vaccines. We are now at almost 196,000 active licenses. If y'all remember a couple of years back, we were trying to get additional vet services. We were at 145,000 licenses. So we've increased by almost 50,000 licenses in that couple of years through the hard work of our team. And also, we brought in over $3 million in revenue through our licensing program last year, which I think is pretty phenomenal. We also do our permitting programs. We have 3 pet stores in the county through our permitting program. We have 31 individual pet dealers who do not work through pet stores. We have 15 hobby breeders. We also have 53 kennels and trainers, along with a few guard dogs that are still permitted through our system. And that is our logo for a closer look. Any questions?
Any questions? Yes.
So I didn't hear you say anything about the app Finding Rover. Is that yours?
That we are in partnership with Finding Rover. What we do is every lost pet that we have is automatically uploaded to Finding Rover, and we get emails several times a week now from people trying to find their lost pets. That is just an additional app that's mobile device driven, because we already have the same functions through our website. But a lot of people no longer use computers, they use tablets and phones. So Finding Rover was a much better mechanism to get that out to those folks.
I just thought it was kind of ingenious, and my husband is all about it.
And it doesn't cost the county anything. It is a free partnership. So we're very happy with that.
Commissioner Welch?
Doug, great presentation. Thanks to you and your team. Couple questions.
Yes, sir.
You know, we've talked about your number of field officers in the past, and just noticing your budget slightly went down in 19.
Yes, sir.
So how are we doing with the number and the response time?
Our response time, we gauge it every month. Our response time for High priority calls is within the same day. If it's an emergency call through a citizen animal in distress or a law enforcement call, it's probably within an hour on the weekday. Weekends take a little longer as we have less people in the field on Saturdays. For normal calls, low priority calls such as barking or other, just the things that are not emergent or the animal cannot be in distress, we are usually responding within 48 hours. So usually 1 to 2 business days on those.
So do you feel you're at the right level of staffing there, or is there still room for improvement?
There's always room for improvement. We are actually coming up with a new enforcement staffing plan for next fiscal year. We're working on what equipment would be needed to expand officer coverage to Sundays as well. But we're still in the development process on that because we would need some additional equipment to be able to rearrange some of the staff to get that additional day of coverage.
Okay. Madam Chair, 2 other quick ones. You mentioned it, but give us the 30-second advice on coyotes, because we still get those questions.
Coyotes have been here a long time. Coyotes are very savvy urban dwellers, and they are here to stay. They don't attack people. They will attack and prey on cats and small dogs, even if your small dog is on a leash. So we try to get our citizens to understand. Keep your cats indoors if possible. If you're walking your dog, especially a small dog, try not to do it at dawn and dusk, because those are your more likely times during the day. You're going to see some coyotes because they've gotten so comfortable. But do not feed them. Keep your trash covered. Don't feed your cats and dogs outside, because that's going to attract those coyotes. We've got an issue at Top of the World. We're still working with Fish and Wildlife and their management company to take care of, because there was a stray dog living there that has been for months that nobody can catch. And so all the citizens were putting food out so that the dog didn't starve, but the coyotes are coming up and eating the food, and now they've taken up residence on the golf course. So we're trying to get that mitigated as quickly as we can.
Okay, thank you. Last question is, you sent us a resolution from the St. Pete City Council on leaving dogs in pens.
Yes, sir.
And you also sent us the complaint that shows a really nice
There were no issues. There were no
setup
violations
for that
observed.
particular, and that was the only complaint that,
That was the only complaint that was sent to the city that we are aware of.
okay.
That particular resolution is something that the city of St. Petersburg could put into their city ordinances and enforce through their city council or their city code enforcement, because they already have an animal ordinance that we don't have, which is the limitation of number of pets that can be owned in the city, and they enforce that through their city code enforcement. We do not enforce that.
But we did not cite this owner, right?
No, there were no
Because that
violations found. It was
a very nice setup.
the owner for that particular complaint, from what, reading the report, the dog is allowed to be loose in the backyard when the owner is home, but he keeps it in the kennel to be more secure so he doesn't get loose when he is not at home. And the kennel is of adequate size, the shelter is adequate. I mean, it was a really,
It's covered as shelter. In this photo, it's in the shade.
yes, sir.
So, okay,
There were no issues with that one.
thank you.
Commissioner Justice, then Commissioner Long.
Thank you, Madam Chair. Do we still have is going through the process? I know that we've expanded our partnerships with all the different other animal organizations
Yes, sir.
in the county. Is it still to where they do I don't know the right sweep for better, come in and cherry pick?
They come in, we have,
I'm not probably using the right,
well, two of the agencies, our major partners, Humane Society of Pinellas and SPCA Tampa Bay, both come over probably at least once a week and take dogs from us. Last year, Humane Society took 375 dogs and cats from us, which is a significant number, and that is almost 400 animals we did not have to try to house and treat and find homes for, because they took them. And for those two partners, we don't have to provide the medical care because they can take them. They have their own veterinary staffs, and it saves the county money. But we also have 107 individual rescues that pull a few dogs and cats here and there. We've got a couple of cat rescues now that are pulling a large number of cats and putting them in a pet store here in the county in an association with us as well.
okay.
Thank you, Madam Chair. So Commissioner Eggers isn't here today, and on behalf of him, I have to say, I'm pretty impressed that we haven't had a lot of huge issues surfacing up in North County. You've got all of those under control, I'm assuming.
We are doing our best.
Great.
Yes,
Anything we need to know since we're sitting here?
No, ma'am. We're trying to be as responsive and proactive as we can to mitigate issues before they become big issues. And when issues of a law enforcement nature come up, we've been working really hard to improve our relationships with our law enforcement partners. And we've actually got points of contact for cruelty investigations and prosecution now at almost all of our law enforcement partners within the county to make that process easy.
Nice, thank you.
Well, thank you, Doug, and thanks to your team. You all have certainly done wonders over the last few years, and we're very, very proud of Animal Services and
Thank you.
the good care that you provide to our four-legged friends.
Thank y'all very much.
Thank you.
Commissioners, next up, we have Safety and Emergency Services. And Jim is on his way up and talking about, data. I watched them yesterday with their data, and it's amazing the way they work and analyze different aspects of our emergency services. So, Jim?
Thank you very much. Jim Fogarty, Director of Safety and Emergency Services. And I want to thank Doug. I'm always reluctant to follow Animal Services because he always ends a slide with a cute little puppy dog. And I had a strategy. If you did that, I was going to put lights and sirens, fire trucks up first because I can usually counter that. So. I'm here to talk about safety and emergency services. And let's see if I can get this. I'd like to just spend a second to introduce my team here today. Safety and Emergency Services represents just under 200 county administrator employees. And we have 4 divisions. I want to present as the 4 divisions but one department. I think that's important to understand. The public knows us as Safety and Emergency Services, but we actually have 4 divisions. The largest of the divisions is our Regional 911 Center, and Chuck Freeman, Director of Regional 911, is here. Chuck? He has about 130 folks working for him at any given point in time. They're the folks behind the phones at the 911 Center. Next, we have our Radio and Technology Group. Jackie Weinrich, the director, is there. She's got 14 folks. She's responsible for keeping the radio systems up and the computer systems up that I'll tell you about in just a couple of minutes. Next, we have our Financial Services and Ambulance Billing. Pam Bell is here. Jody Sessler could not be here today. Pam Bell is here. They've got roughly 40 folks that keeps the revenue flowing into our system appropriately and keeps us out of trouble with compliance and audits. And then finally, we've got Greg Woodrum from our Fire and EMS Administration. Greg's Administrative Manager at Fire and EMS. Craig Hare couldn't be here this morning. Greg has about 13 folks working for him, although he's got the smallest number of folks. By a large measure, the largest budget is part of Fire and EMS, some $130 million, mostly pass-through dollars that go to the fire departments and the ambulance contractor. What we do, there's anybody that dials 911 in this county, that call goes to only one place. The primary public safety answering point is the Regional 911 Center. It's off of Olmerton Road on the 3rd floor down there. Many of you have seen that. Processes about 1.2 million calls a year. I have a slide that breaks down those calls by type. But it also serves as the dispatch for all of the fire and EMS units in the county. It co-locates the Pinellas County Sheriff's Department. They have their dispatchers sitting right next to the fire dispatchers. They also maintain all of the 911 equipment, the consoles, the computer networks, the leased services for the agencies, not only for the primary 911 center that we have, but the 5 other secondary centers, the city of St. Petersburg, city of Largo, Pinellas Park, Tarpon Springs, and Clearwater have secondary PSAPs. All of that equipment is maintained to the Regional 911 service that the county manages. Our ambulance billing and financial services sends out thousands of invoices subsequent to a ambulance transport, but they also manage the membership program. And last year I gave you 3 commercials. This year I'm going to give you only 2. And when I was asked for the phone number last year, I didn't know it off the top of my head. I promise you I know it this year. Phone number is 582-2008. We have an ambulance membership program. This is commercial number 1. It really is designed to help offset the financial impact an ambulance bill might have to someone who could least afford it. It's $68 for an individual membership and $103 for a family membership, and it's really a good value. The folks watching at home should really consider whether that would be a valuable use of their money. Because the ambulance ride to the hospital can get quite expensive. Our ambulance retail rate is about $670. We're on the low average, by the way, of the community. But that plus mileage, you could find yourself with a $700 ambulance bill that your insurance carrier may or may not decide to cover some, all, or none. So the ambulance membership program, there's the commercial, is something that you really should consider before you have to actually need it. Ambulance billing manages the compliance with federal, state, and local regulations. There's a lot of healthcare regulations associated with the billing process and the compliance with some of the records management. They, in no small task, manage the entire budget of all safety and emergency services. Again, although we have 4 individual divisions, financial services manages the budgets for all 4 of those divisions. They process all the accounts payable for the department, and then they coordinate a various number of audits, federal audits associated with healthcare billing, and then financial audits associated with the good practices. Our radio and technology division manages a countywide intergovernmental emergency service grade radio network. And it's not just the emergency services. The Pinellas County Transit Authority is on that system. There are several municipal utilities on the system. It's a system that has over 10,000 users, agencies that use it, and it's quite reliable. It's a secure, they also manage a secure computer network that provides interconnections between the computer-aided dispatches. We, as a county, have our own in-house version of computer-aided dispatch called Core CAD. We've had it for years. It's a very effective, very easy to program. I don't say easy to program because I don't have to program it, but they seem to be able to do the programming much quicker than some of the commercial carriers for CADs out there. But they also have interfaces with those CAD programs that mostly police departments utilize. They have wireless dispatch software they maintain. They maintain the reporting systems for the fire service, the NINFRS systems that report on the incidents of fires and medical calls. And then finally, they do some geographic mapping using ESRI. Fire and
Real quick question,
Yes, sir.
Madam Chair, while we're there. Waiting for you to go back one slide. So while you're on that topic, can you talk briefly about the backup functionality that the new St. Pete police station will provide to the county?
I will, sir. I can talk about it now, or I have a slide,
You've got a slide? Okay.
later on that functionality.
All right,
So
we'll wait for that.
Okay.
Thank you.
I'm being respectful of time, too. My counterparts didn't go over, and if I go over, I can see my boss is going to. The Fire and EMS Administration handles the ALS first response contracts that we have with the 18 municipal fire departments and independent fire districts. They manage probably one of the largest county contracts, the ambulance transportation contract, coordinate the fire protection within the dependent and independent fire districts through contracts, coordinate a single point of medical direction. Dr. Angus Jameson, as our medical director, has been for a number of years, coordinates the meetings associated with the Medical Control Board, the EMS Advisory Council. They also have taken on the role of providing direct continuing medical education for the last 3 to 4 years. They are the actual providers of the curriculum and the delivery methods for the recertification needs and the initial certification needs for all paramedics and EMTs in our system. And then they coordinate special operations, things like the hazardous materials team, the technical rescue team, some of the marine response assets you see. So they have quite a list of things that they do. This slide describes the typical call. You might not realize how often folks find the need to dial 911. The green bar shows over the last 2 years a slight reduction in incoming 911 calls. We'd like to think it's due to some of the efforts we started a number of years ago with growth management. I don't think that's the case. I think there's some seasonal variation that just naturally occurs. But you know, for whatever reason, we have seen a slight reduction in incoming 911 calls. Of those green bar calls, that represents about 650,000. About 2/3 of them represent law enforcement requests, and 1/3 of them are fire and EMS requests. You also note that the call takers also have to place a lot of phone calls on the outbound side as they do follow-ups and notifications and callbacks over the course of a day. And then this system also manages the non-emergency 10-digit line that the sheriff office maintains. And that graph shows you sort of an annual view, but I checked on the way in this morning. Last night, last 24 hours, the center handled roughly 1,496 calls. Of those calls, 160 of them were pocket dials, hang up. And so we've gone through some efficiencies in terms of not having our call takers have to auto redial those pocket dial calls, and by implementing the automatic redial software, we've been able to reduce the number of accidental hang-ups that we have going on and the time it takes for the call takers to handle those. A lot of success stories over the last year. I don't have time to go over many of them, but you recall that the various technologies that we asked the board to support, and some of them are listed here, not all of them, but we've recognized there's a balance between employee talent and technical prowess in our center. And in terms of the employee talent, we've been recognized nationally and internationally for our director, for some of our operations manager, for the call takers functions by some pretty reputable organizations. Chuck Freeman was recognized as Director of the Year by APCO and NEMA, the National Emergency Numbers Association. Ellie Childs, our operations manager, she's on duty right now at the center. She was recognized as Supervisor of the Year. And then Margaret Dorman, the EMD Dispatcher of the Year. So we've got a recognition system for the employee talent base, but we also have the technology, and they need to meld together to work correctly. And so I'll tell you a little bit of a story about the technology. Text to 911, you see that photograph is the very first text to 911 signal that was sent out in our county around August before we even announced it, because we wanted to make sure that it actually worked. You know, within a week or so of us turning the switch on, we did get text to 911 emergency traffic where someone was locked in a closet under domestic violence situation. So the system and the technology and the approach worked. You'll hear soon, probably next week, about a new technology, the Rapid SOS, the amendment that we put before you about 3 months ago. Rapid SOS is a GPS locating system associated with wireless phones. We programmed our center. It can provide the location to within a few feet of the wireless phone. And just as a tell the story, we had a situation where a kayaker capsized the boat about a half a mile offshore of the Reddingtons, and was well beyond the sight of anybody on shore, was able to dial 911. You'll hear the story, but because of the Rapid SOS, we were able to direct the 5 responding agencies, which took them about 20 minutes to get to this individual who's so far out. And we were able to watch him drift out into the Gulf with a lat-long information provided with Rapid SOS. So there's a lot of success stories in that center that you'll hear told. You'll probably hear that story next week. The manufacturer of that particular product wants to use it as a marketing tool because it's so effective here in the county. But we've done other things too. We've improved the 10-second 911 answer time. The requirement is that you answer the phone within 10 seconds 90% of the time. We've achieved that for a number of years, but the last year we've actually pushed that to 93%. I checked this morning. Over last night it was 96% answer time. So when you dial 911, that phone will be picked up in less than 10 seconds. We're pretty confident on that. Other centers are challenged to meet that. Our center has been routinely meeting it for almost a year right now. And then we've had some partnerships. We've partnered with our police agencies. Largo, they actually co-located their emergency PSAP inside our center while they rebuilt theirs. We were able to successfully handle a challenge that Pinellas Park had when they lost power in their center. And so we have these partnerships that we can cover for each other when necessary, and the public really doesn't recognize that anything has happened, which is the way it should be. The fire and EMS system has done quite a bit to implement some of our growth management strategies. That's not just growth management, meaning priority dispatch, it is some of that, but some of the things that they've been able to do in terms of managing the growth of requests for services, things like safe baby sleeping, the car seats campaign, we've got a drowning prevention initiative going on in Palm Harbor. And so we are very strategic and very focused on how and when to try to manage or prevent the 911 call from actually occurring. We've developed a rapid rescue task force under the active assailant that you probably have witnessed with some of the massive shootings that have occurred throughout the nation. And so we've prepared our community to respond to those. In terms of some of our capital projects, we've got partnerships. We've got a multi-purpose facility that's on the drawing board and about ready to go for proposal that solves a long-standing EMS response issue in the Reddington Beaches area. Over 15 years ago, their fire station was closed, and they really, up till now, haven't had a great solution in terms of how that would be corrected. And so we've got a multi-purpose facility, combination of the sewer lift station, the public works from some of the Reddingtons, and then our EMS system to build that facility. We've also done some cooperative studies. We've looked at the potential for a fire station in Seminole. We call that the Bay Pines District. They've had some set-aside property there for a number of years. We're working closely with Seminole to try to understand when they decide to actually build this. But we also analyzed it in conjunction with Engine Station 2, which is a St. Petersburg location just immediately adjacent to that, and the Station 19 location, which is a Laleman location. So it's rare that you can make these capital decisions in isolation. We try to look at the 2 or 3 adjacent districts before we make a capital decision as to where to build a fire station.
Madam Chair, so did we make a decision, or when will we get to that point?
So in terms of Seminole, we're waiting for guidance from the city of Seminole. So they have not yet decided to build the station. They have the property. They may build the station, but it won't be this year. It may be next year or the year after that. The Laleman Fire Station is a station that the fire chief has requested funds to help rebuild. It's Station 19. It's almost 50 years old. And so it likely will be rebuilt at its current location. It's an appropriate location based on analysis that we've done. And regardless of the Seminole location, whether it's built or not, it still remains the proper location. And then the Engine 2, the St. Petersburg location, I think the St. Petersburg location is suffering from a lack of available property. And so currently they rent a space in industrial park.
It's an old house.
It's an old, right, yeah. So I think once they locate them, we did analyze some of the potential properties and found that it was really not a great site for them to pursue, and they appreciated us providing that information. So they're still searching for property.
So that grant, that grant that they had for the operation of the one on 66th Street, that grant is gone or expiring?
It is expiring. I don't want to speak for the city of St. Petersburg. I believe they intend to keep that location staffed. The location is partially paid for as an ALS first response vehicle, but the other 2 seats are city funded. So I think their intention is to keep that funded.
Commissioners?
Thank you. Are the call volumes dictating that we need a facility in Seminole by Bay Pines? I understand the population, the densities are growing over there, but currently is the call volume dictating that it's necessary?
It's not necessarily call volume. Call volume is one of the components that we look at. The call volume has grown, but it hasn't grown to the point where, oh my goodness, you have to add a fire station, because there's different approaches to just adding a fire station. But it's the response time that is most, and in terms of the response time, it's likely the fire response time. They've got an industrial area just to the north of that identified location. It's very difficult to get to. There's some boat manufacturers, and so if they were to have a structure fire up in that area, to get the first 2 response units there would be longer than they would like. So we look at the response times. The response times to some of the fringe locations for EMS are longer, but they're not. We measure it 7 minutes and 30 seconds with a 90% fractile time, and they currently meet that with the exception of some very fringe areas of that district.
Okay, thank you.
Commissioner Lyons?
Yes, and I just wanted to give you an update, because just so happens I met with Mayor Waters yesterday afternoon, and she and her group are going to bring this forward for discussions. We ought to be getting some indication from them shortly as to what their plan is.
Okay.
Just wanted you to know.
Thank you very much.
You're welcome.
Let me go on and tell you a little bit about our revenue streams in terms of the number of ambulance claims that have been billed. And when I say billed, there were more ambulance transports, but some were not billed for various reasons, reasons of medical necessity, reasons for legal issues, but not every ambulance claim is able to be billed right away. But you can see the sudden, not sudden, but the unexpected drop in claims billed. But the important point that I'd like to make is the revenue side of that equation. It really reflects some of the efficiencies associated with ambulance billing and financial services abilities to collect. We had fewer bills that were sent, but we've actually appreciated more revenue associated with those bills. Buried in those bar charts are the subtleties associated with the emergency revenue stream, the non-emergency revenue stream, and everything in between. And so, you know, it's a testament to their efforts that even though there were fewer bills sent, the collections were more.
I had a question. Is that because people that weren't paying them are now paying? Or because the calls went down, the billing went down, but the revenue is still increasing? So did we raise rates, or are people not delinquent?
No, we don't, we raise rates only when we present to the board to raise our retail rates. The rates, the predominant reason for the efficiencies have to do with our ability to process bills. We entered into some contracts with some third-party vendors that can scrub our billing practices before the bill's sent out and make sure there's no errors, there's no corrections. And so to make sure there's no delay in getting the payer like Medicare or some of the commercial carriers, rather than send it out, have them send it back and send it back out again for corrections. Our third-party vendors in some of the in-house difficult cases they've been able to focus in on, that's what improved the revenue stream. It was really a quality standard of sending the bill out.
Thank you.
Can I ask a follow-up?
Yes.
Over there, I had a similar question. There's a metric in your budget, percent of net collection for ambulance charges, and was at 63%. Is that saying we collect 63% of what we bill?
That's correct, 63% of what we billed.
And that's gone down to 61 for FY19. So what's the reason for that? Is it of insurance, or what's driving that to go down?
Well, I probably have to defer to the Pam. I think in general, some of the difficulties in collection have to do with some of the changes to healthcare. For instance, one of the big changes, and in one of my slides further on, you'll see the non-emergency business as transportation brokers try to drive down the costs of transportations to and from medical facilities. They put quite a few additional requirements on the ability to send a bill. You have to, in many cases, have physician certification statement. You have to have pre-authorization. You have to have sort of a laundry list of things that really aren't standard. If you're talking to Logisticare as a transportation broker, they have one set of requirements. If you're talking to MTM, they have a different set of requirements. So because of somewhat changing requirements, and when I say changing, more restrictive requirements in terms of being able to send the bill, particularly some of the Medicaid cases. Plus, in some cases, the rates that their transportation brokers are willing to pay, for instance, Medicaid reimbursement rate, if they do pay, which they often don't, has been $190 for decades. And so the rate has not changed, and the ability to even collect that has become challenging.
So right off the bat, if it's that type of ride, you're not going to receive the full price is what, 500?
So our retail rate, which is what the rate we have the board approve, is $673.
My goodness.
So the average transportation is about $727 when you look at the retail rate plus the mileage that are associated with that. And so our ability to collect that, our payer mix, I think, is just under 60%, I think 53% Medicare, 55% Medicare. And so Medicaid. And each of those, Medicare, Medicaid, has an allowable rate they're willing to pay. So regardless if we send a $723 ambulance bill, a Medicare patient will only get $462 in terms
So
of
you
what
got
you're
it
paying.
built in.
That's correct.
And last question, what percent of the transports are Medicare? Is that the right one?
Yeah, Medicare is about 55% of our payer mix.
You probably need to come up, sorry.
Good morning. My
Morning.
name is Pam Bell, and I'm the regulatory manager for ambulance billing and financial services. And Medicare is 55% of our payer mix, so they're the biggest part of our payer mix. So whatever thing they institute for Medicare, and their collectibles are dictated by statute. So we can only collect the Medicare allowable, and because there's so much of our payer mix, that cuts down on. And also the percentage that you mentioned that we collect, that is of the allowable, not of everything we bill,
Okay,
okay?
thank you. Thank you, Madam Chair.
Before she goes, I have another question for her. Before you go, ma'am?
Pam?
Yes, Pam?
Pam? Commissioner Peters has another question for you.
So, when you get a call on an overdose and you have to transport, many of those will be males that don't qualify for Medicaid. So how many are indigent or people that we cannot collect? What do you do with that? Does the state cover an overdose thing, even though typically they don't give Medicaid to males over 26? And I assume many of them can't afford to pay. So how does that handle, and what's our indigent care that people cannot afford to pay? Can you explain all that to me?
Well, as Jim mentioned, we do have the ambulance membership program. It must not necessarily for indigent, but for Medicaid, the fees are even lower. They haven't changed since the 1980s. For non-emergency transport, we get $136. For an emergency transport, we get $190. We do not waive fees per se, but we do have a payment plan that is low as $15 per month. For Medicaid, if we take what we get and we typically write off the rest, because with Medicaid, to even bill a patient, you have to give them an advanced beneficiary notice, a ABN, and if you don't give that to them ahead of the transport, that actually dictates the rate that you're gonna bill them, and you can't bill them any more than that. And right now, we don't do that because of the way our dispatch is set up. So we write it off. We don't bill.
Okay, and so for
Medicaid.
males that don't qualify for Medicaid, because a 26-year-old male does not qualify if they don't have children. So we just bill them $15 a month? What do we do with those people?
They can set up a payment plan for $15 a month. It has been a big issue about writing off balances, and there is some barriers to doing that, which would take a higher administrative view because our policy of not writing off fees is primarily based on an opinion that was issued by the state of Florida for a similar question that was posed by the Hillsborough BCC, and their opinion is that their board of county commissioners don't have the authority to write off a bill. For a county operated ambulance service. Now, there were some nuances in that, which maybe Don could speak to, but there was stuff like if you got something in return, like the person had a tax exemption on their home and they didn't take it. So there was some nuances based on that opinion that it has been our policy not to waive fees. And that's the standing opinion by the state of Florida Office of Attorney General.
So how many people don't pay?
Uncollectibles, I don't have that rate, but I probably would say about near 30, close to 25 or 30 that we don't pay and write off, and Jody could probably give specific numbers of what we end up writing off.
Okay, thank you.
Thank you, Pam.
Commercial number 2, this is a great time to recommend the membership program. You see there's about just under 3,000 folks enrolled. We'd love to see that 5,000, maybe 8,000, because someone who isn't qualified for Medicare, they're not 65 or they're not disabled, someone who doesn't qualify for Medicaid, someone who does not have health insurance for whatever reason, would find themselves getting an ambulance bill that eventually we suspect would have to write off if we were uncollectible. With a membership program, there's assistance in terms of what that charge would actually be. And so, the time to consider that is now. And I have an understanding that, even $68 for someone who's homeless and doesn't have the funds to do that is challenging. So I can appreciate that. But that's really what the membership was designed to do. It's designed to be financially neutral, but also prevent an inordinate burden to someone who would otherwise have financial challenges. I wanted to also tell another story about how this four divisions operate really seamlessly as one department, and I'll use the radio and technology as an example because over the last year our radio and technology division has completely upgraded the Motorola radio hardware and software that manages and runs the radio system. It's called a Master Prime, and Jackie knows all about this, but there was not one ambulance or wasn't one police officer that pushed their push-to-talk button that even knew that this upgrade was occurring. And so the entire hardware of the radio system and the software associated with that has been upgraded successfully with absolutely no downtime. And I'll tell another story when the sheriff decided their helicopter, which they generally uses a land-based, ground-based radio system, wanted to operate not only at 1,000 feet but 3,000 feet in a reliable way. Jackie and her team partnered with the sheriff to make sure that radio on not just the one helicopter but all the helicopters operated appropriately, and the sheriff was very appreciative of that. And then finally, she was able to create a non-emergency specific GPS tracking system for the sheriff's deputy. Typically that would be the K-9 officers that go out on foot pursuit, where the radio system can track the location of that officer. Now, of course, from the field perspective, it's just safety and emergency services, and that's really the way it should be. But there was a lot of those things that occurred over the last year. What we use is a report card, a scorecard, an infographic that you see up there that kind of describes all the pieces of the puzzle that occur, and in this county occurs very often. 1 in 5 will take an ambulance ride to the hospital annually, 1 and 2 will actually find the need to call 911 for one reason or the other. So it's a very large system. We survey the system, send about 2 to 3% of all of the ambulance transports. We send them a customer survey letter, and we ask, how did we do? There's 21 questions that start from the experience they had with our regional 911 call takers and end with the professionalism and the clinical care associated with some of the providers. And you can see the satisfaction score. Most folks were satisfied or very satisfied, which we're quite proud of, and which hasn't improved since the time we've been measuring this. In terms of our regional planning, we've got some planning capital projects in the works. We talked a little bit about the Reddington multi-use station. We have a major capital project associated with our radio shelters and towers. There are mostly new radio towers associated with our radio system, but there's one over at the EMS building that still needs to be replaced. And then there are 5 control room buildings that manage those radio towers that need to be upgraded for security and for weather-related purposes. You'll see some of that requests come through. That'll complete a 3-phase radio upgrade project. So once that project is complete, the radio system and the towers and the infrastructure will be good for many, many, many years, decades to come. It will make it a Category 5 standard radio system that the hurricane forces hopefully won't interfere with. We've got some operational improvements underway with the fire EMS system and the regional 911. Operational improvements include some challenges that the first responder has. North part of the county has some response time challenges. We're not sure whether that's related to traffic patterns or some of the bridge constructions that are going on up in the area. So we're working closely with those organizations to try to better understand what those challenges are. There's some requests we're getting from the fire and EMS folks for better field supervision and span of control associated with those. And so we're working closely with the partnership agencies to make sure that's done appropriately. A lot of quality improvement efforts going on. The stroke destination study that Dr. Jameson put in place is looking at the effect of taking patients to a comprehensive stroke center, and so far the initial results are quite promising. We're also looking at the dispatcher-assisted CPR instructions, the return of spontaneous circulation associated with cardiac arrest. And in terms of research, we're about ready to take a look at the effect of both cumulative and incidental stress associated with the first responders. We're hoping to have a formal review process in place before the end of the year. We're also doing a deep dive in analyzing the non-emergency transport sector. There's been a lot of changes. We're not sure whether those changes are permanent or temporary in terms of the non-emergency transport. What we do know of that particular revenue stream has declined pretty significantly over the last 4 or 5 years. And so we're looking at that and try to best understand what is involved with that and what changes would be necessary, if any, associated with the ambulance contract.
Madam Chair, I don't mean to interrupt in this piece, but it brings to mind that last year, at some point, we had the 4 fire chiefs that came and spoke about a pilot that they were putting in place to alleviate some of the non-emergency transports. Do you have any data on how that pilot program has been working and/or if they plan to expand it?
We do. The pilot program that you're referring to had part of our growth management strategy focused in on falls, locations that had a high incidence of falls. South Pasadena was one example where the largest user of 911, that location, partners with the fire department and safety emergency services to do the common sense things to prevent the falls. They were able to reduce the incidence of 911 calls by 17% in less than a year. So the approach is hopefully going to be replicated. We currently have a matching grant in with the State Department of Health, EMS, to try and take what was so successful in those areas and expand it throughout the county, particularly with some of the facilities associated with adult living, whether that's nursing care or independent living, and some of the mobile home communities that have a high incidence of this as well. But that's not the only area that we've managed. We had a very successful project, and you see some of the updated service models, a successful product over at Jail Health, where it had been the case that emergency services would run into jail health, and we changed that protocol and recognized the 50% reduction in the emergency services response to the jail, specifically based on the new protocol that we have in place over the 49th Street area. And there's many examples. The goal is to take what piloted and proved to be effective and expanded as it's most appropriate countywide. St. Petersburg is involved with some of those programs with us. Largo Fire Department is. City of Clearwater, Palm Harbor is. So yeah, we're trying to expand those programs.
Excellent, thank you.
And again, that speaks to the managing of the growth. It's easy to say, okay, we're just going to manage growth, but it's really strategic. It's almost surgical to develop an outreach to growth and what can and what can't be managed, what should be expected. If you look at the bottom graphic, the life-threatening event, we should always be prepared and are prepared to have our resources deployed to that crisis situation. To the extent that some of the non-crisis situations are tying up some of these resources, we're trying to better understand that and better deploy that. Priority dispatch is one such example, where an individual who doesn't have a life-threatening situation, we're pretty confident the crews are not responding emergency at all. They haven't been for a number of years. Rather than send 2 advanced resources, to send only 1 advanced resource to that location.
Commissioner Gerard?
I just wanted to say that, I just wanted to congratulate you on how far we've come with even saying those words out loud, priority dispatch, because that was such a hot topic a few years ago.
Seriously, sure was.
And the fire departments seem to be right on board and working along with you, so that's amazing. That's a bit of,
The fire departments have a tough job to do. They
I know.
realize the importance of having a response vehicle available, ready to go for that life-threatening event. We like to get there just as fast as possible. But if that same resource is doing a public service, a lift assist, it becomes challenging to do that, and they recognize that. And
5 years ago, you didn't dare say those words in front of a fire chief. It's like,
Well, but, and to that
wonderful.
end,
Yeah, it's
they work so
amazing.
diligently with the fire chiefs. They really
Well, between you and John Bennett, you've done
all
an
about
incredible
it.
job.
It's all been about data
Yeah,
and really trying to communicate, and so I agree, thank you.
It's also about relationships. And one
yeah,
thing,
absolutely.
everybody's done a great job building those important relationships.
Well, thank you, and I think this board has as well, so I think you need to take some of the credit there as well. But don't be fooled, emergency services will and must grow. We have a growing population, we have an aging population, and so it would be false to think that we're not going to have to grow the emergency services piece of that. We just want to make sure it's grown appropriately. The non-emergency services piece seems to be the piece that's growing faster than the population, so that's where our focus area is. But there still are some areas, particularly in the high-growth areas, downtown St. Petersburg is an example, Clearwater is an example, where we may have to add emergency services as well. And then here's, I wanted to answer your question directly about our partnership with the St. Pete Police Department. To understand, they're going to be dedicating that facility March 22nd, I believe. And so we've really developed an incredible relationship with that center. That center serves as the backup should something untoward happen to our regional 911 center. There's consoles back right down there, and ours serves as theirs. If you walked in the center and you looked over to the left, immediate to the left, you'd see 20 consoles that were configured with the radios and the CAD systems, where the St. Pete Police Department could just walk in there, turn the switches, and operate as if nothing would happen. And our center could do as well. So we've really had some great partnerships with them. I know they've had some challenges getting the building completed. By all measures, it's going to be completed, and they'll be ready to move in. I think, Chuck, I think there's actually a switchover date. Is that a public date?
Yes. Well, right now it's April 3rd, but it's public.
So the switchover date is when they flip the switch at their current location and they move into their new location. So I hope that was a public information. Yeah. So we're trying to develop similar partnerships with the other centers. Like I say, we had Largo co-locate with us for a number of months while they rebuilt their center. I'm meeting with the city of Clearwater. They have some challenges in their communication center in terms of building and infrastructure and some of the long-term plans. And so I meet with them on Thursday to talk through what partnerships we might be able to develop with the city of Clearwater.
Madam Chair?
Yes.
Yeah. So thank you for this slide in particular. And am I correct in assuming that our location for backup data is going to be in the new St. Pete Police Department? Is that correct?
For public safety, yes.
For public safety. So that brings me to another thought, and that there's been an awful lot of discussion at various levels of different boards and organizations that I sit on or participate in about the fact that what if a Hurricane Michael, for example, came through Pinellas County? Wouldn't it seem wise that we would try to somehow outsource our backup materials to another part of the country where we don't run the risk of having both places be blown away?
Well, if I might refer that question to
Brian and I can do it. Go ahead.
Brian Zumwalt, Office of Technology and Innovation.
Hello.
I'll speak a little bit on behalf of BTS since they're not here at this meeting, but we're using a combination of both on-prem backups. We have backup locations for our corporate system, or our enterprise systems at the Enterprise Resource Building over at the Public Works Building. But we use a combination of both. Cloud, that's one of our new strategies, is backing up things into the cloud rather than having that on-prem backup system. With respect to 911, I think that also BTS is talking right now to St. Pete about, I know that there's some space down in the St. Pete building that we can co-locate servers down there. I think St. Pete has also made the request to use our facility at the public safety complex. So I think there's a combination of strategies there for backup that are used all over the place. But you guys would certainly have to have your strategy in place.
Jackie, do you have anything to add to that?
Good morning.
Morning.
Jackie Weinreich, Radio and Technology. We do. We have a complete backup of our network. That will be a decision package you'll see with the budget coming up. We'll have dual CAD machines there, so we'll actually have 4 servers to support the computer-aided dispatch for 911, police, and fire. And they run high availability cluster management protocol, bunch of whiz-bang terms. So 2 will be at St. Pete, 2 will be here. All of our data is backed up, and in the event of a storm, we have our data, and we remove it from the county in the event of a catastrophic event like a tornado or something that wipes out both centers. But we also have dual master and prime at St. Pete at that new Category 5 radio and shelter tower site that we built
So
last year.
my specific question, though, was, and I think I heard you answer it, we do move it out of Pinellas County
We do.
somewhere?
We do.
Good, that's all I need to know.
I can pick up
Thank
those
you.
computers and drive away with them if I have to.
Really, they're that tiny?
Yes.
Wow,
Mr. Justice, if you look puzzled.
Nope, I'm good.
thank you.
Thank you, Jackie.
Any other questions? We have some work to do with our telecommunicators. We're working to improve our 1 to 3 year retention rate. There's been a lot of changes in the telecommunication industry. What we're asking them to do, the certifications, requirements, if you sit and watch, they multitask with 4 or 5 screens and 4 or 5 different computer programs. And so we are struggling and have put some things in place, but more work needs to be done. The Evergreen study has dramatically improved the pay, so we recognize that was one issue. The current retirement system that they're under is under review up in Tallahassee. They're considering special risk class in terms of their career progression, and I think that's a necessary piece of this. A special risk class would allow not only telecommunicators, but other public safety officials like police officers and firefighters that are already in the industry that may have physical impairment and returning to work. It'll open that career up for them to be telecommunicators as well. And so we've also done some other things. We've got employee surveys. We've got different shift schedules and configurations. So we're working hard to try and improve our retention and recruitment, but more work needs to be done on that. Again, we're approaching the final phase of our radio tower shelter replacement project. I had mentioned that before. The hope is to be complete within 2 years, 2 to 3 years at the most. And that will harden the 5 remaining shelters to a Category 5 standard and replace the Ridgecrest Tower, which is actually 2 towers. Those will be taken down and 1 tower will be in its place. We'll also do the analysis of the non-emergency transportation sector. We're going to evaluate the public safety education systems. The fire training tower, for example, is a 25 to 30-year-old facility operated by the St. Pete College. That facility may or may not need upgrade or replacement. The health education campus that does the EMT and paramedic training, the All-State Center, which has taken on the role of the telecommunicator training. So we're looking at all of the public safety training needs, not only for now, but into the future in terms of, what does the future hold and how and what role does the county play, and, a coordinated effort to making sure that's improved. We're also, just as an example, last year we asked for an additional FTE, logistics coordinator from our fire EMS. We actually hired that, and that young lady was given the challenge to improve fiscally pharmaceuticals and the distribution networks. I'm happy to report that that position has far exceeded the cost of that position. We budgeted $100,000. We're well exceeding that in terms of savings by direct purchasings of some of the pharmaceuticals rather than going through vendors, through vendor inventory management practices. And so we really struck gold with improvements to logistics, and more to come on that. And then we're going to continue the data-driven focus group, the group of fire chiefs and counties that look at the data, look at what is happening in our system in a real-time factual basis, and in an effort to make informed decisions going forward. So, and my final commercial, 582-2008. If you would consider joining the membership program, you can call that phone number or go to our website. There's direct links to the membership program on our website. You'll see signs in the elevator as you go down from this building, right on the wall with the membership program.
Mr. Justice.
Thank you, Madam Chair. Just a couple quick ones. On slide 13, you've got that great graphic image. If we could get a copy of just that image.
Yes, sir.
I
The
agree.
infographic?
Yeah, the infographic, I don't know if you have it or marketing, but that, yeah, if we can get a copy of that. And then the second part actually goes to the bottom of that, on their calls. What percentage of our calls are actual fire calls?
Fire versus EMS, off the top of my head, in general, it's about 10 to 13%.
Still staying pretty constant then.
It's pretty constant, right.
Okay,
Pretty
thank you.
constant.
Any other questions? Great presentation. Thank you for, again, amazing job that you all do and the tremendous progress that's been made over the last few years.
Thank you very much.
Make us proud. Thank you.
Great. Commissioners, next up, we have emergency management and our fairly new emergency manager, Catherine Perkins.
Good morning.
Good morning. How is
Morning.
everybody today?
Great.
Great.
Good.
Good morning, Kathy Perkins. I'm the Director for Emergency Management. I have with me today Joe Bories, who is our Operations Manager, and he's really been my right-hand person and quintessential in helping me get oriented to Pinellas County and understanding all the systems and how they work here. So it's my pleasure to be able to talk about the amazing work that was primarily done before I even got here. So very happy to join this team. We have 13 and a half full-time employees. And I just want to talk a little bit about how the varied backgrounds of our employees really make a difference in the work that we do. We come from social services, we have military personnel, first responders, we have folks that work in geographic information systems, we have folks that have come from a private nonprofit, and this diversity really helps us with our whole community planning. These are the same types of entities that we count on and rely upon and coordinate with for all of our disaster responses. We're also very fortunate to be supplemented in our office by Mason County volunteers and also to be able to have 3 interns from local universities who really make a difference in our operations. So what do? We actually think about and talk about and plan about all the things that nobody else wants to think about, right? So we're thinking about those catastrophic events. We worry about hurricanes, we worry about hazmat, we worry about tornadoes. We are there every day of the year worrying about and planning for those catastrophic types of events. We collaborate with and coordinate with all sectors of the community. So as you heard me talk about the whole community, those are the very folks that we coordinate with to make sure that we're all. Sorry. It's advancing here.
Yeah, we're not seeing it on our screens. Here we go. Okay.
Sorry with that. And you've heard from a number of our other directors this morning about how they also spend times in their activities year-round supporting emergency management. And that criticality of collaboration is across the board. Our time is really spent working with our partner agencies. So a lot of people think, well, you're off for 6 months of the year, right? Because hurricane season's only 6 months. But we're actually, this is the busiest time of year for us because this is the time of year that we're out having meetings, we're planning and we're preparing. We're making sure that our systems are operational and ready to go when hurricane season gets here. And whether we're working with our other county departments, training them for the positions that we need them to help support during disasters, or out working with the community and giving them public information and education to make sure that they are as prepared as possible as well. We have a 24-hour duty officer that helps us to monitor events. So just like the cold weather that is moving in tonight, get your sweaters ready for tomorrow morning. We want to make sure that we're keeping our eye on the types of events that could potentially cause issues or problems in our area. And of course, we're always looking at severe weather, tropical systems, and we work very closely with our other partner agencies in terms of when they have issues that they may be seeing coming up in the community. We maintain a contact database of all of our partner agencies to make sure that we can provide alert and notification to them in a timely manner. We also have the system that's called Alert Pinellas. So this allows us to actually send emergency information alerts directly to you, whether it be your email, text, your cell phone. We want to make sure that we keep people informed in terms of if there's an event and give them what protective measures we want them to be able to take. And we will also activate our Emergency Operations Center to support the coordination and response and recovery operations for any event that may occur. For the past year, there was a partial activation of the Emergency Operations Center for Hurricane Michael. And this starts all with us alerting our partners, letting them know that there's a potential threat, And we actually had some folks in shelters on standby in case they were needed. Luckily, we didn't need that here. As I mentioned, we spent a lot of time planning and preparing. So in this past year, we organized 65 different training and exercise classes, reaching over 1,449 attendees. Our education and outreach events, we continue to increase the number of events that we do. We had 129 speaking engagements, reaching an audience of almost 5,000 people. Our dedicated volunteers provided us over 20,000 hours to our department to help us get our community prepared. So one of the greatest volunteer groups that we have is our ham radio operators. We have about 80 personnel that support events year-round going out in the community. Communications is one of the biggest issues after a disaster, and we're very grateful that Safety and Emergency Services has such a robust radio communications. But the ham radio operators are there just in case all of our communications fail. During Hurricane Irma, we assigned those folks to our shelters so that way we were able to have constant communications just in case telephones and radios went down. We have an incredible partnership with Pinellas Park High School. We have a number of youth ambassadors. So this program is in its second year. Our one outreach coordinator, so that's the little stick figure that you see there. Our one outreach coordinator went out and she educated 19 students on hurricane preparedness. These amazing students, in turn, created presentations and then went out during the Great American Teach-In to 57 classrooms. They made 57 presentations, reaching 1,219 middle school students. So we want to start to get that preparedness information out early. Just like we saw with the trends of the recycling and getting people to engage in that, sometimes we can get that information out through our students and help them get their families prepared. Every year, we encourage our community to participate in the Pinellas County Tornado Drill. And I have to throw a dog picture in here because Doug has all those cute pictures, so I wanted to make sure we had a picture in there as well. Our K-9 units participated. We had school students. We had businesses. We had county departments. And we encouraged all of them to send pictures in so we could post it on Facebook. Emergency management is often not something fun that people want to participate in, so we're trying to find ways to engage people and get them prepared. And we had 5,472 signups for our Alert Pinellas system last year. So we'll continue to work with our community and try to get them so that we can get that information right to their phones and keep them informed. So on October 8th, Tropical Storm Michael was in the Gulf of Mexico, and it was being closely monitored by the emergency management personnel here and across the entire state. Acting Director David Halstead at the time led a response operations coordination group call to make sure that the appropriate measures here locally could be taken. So the Pinellas County EOC was activated to a level 2. We had, as we mentioned, we had some shelters on standby in case they were needed. Luckily for us, it wasn't going to be an issue for us, but unfortunately for our neighbors to the north, it was a tremendous storm. So we were actually fortunate to be able to send EM personnel up to Bay County to be able to assist them in their time of need. We had 2 different teams go up, each for 2 weeks each. We had 7 emergency management personnel and one of our amazing interns, which has now gone on to get a paying job in emergency management, go up and be able to sort them. And that's really the best kind of training you can ever have in emergency management. We never want that disaster to hit here, but when we have the opportunity to go up, learn from other communities, and then bring back those best practices or maybe even some of those lessons learned for things we shouldn't do, that's what our staff has been able to bring back. So that was a tremendous experience for all of us. So after Hurricane Irma, an after-action report was developed to be able to look at what were the things that perhaps were done well and what are the things where there's areas for improvement. So there were 492 issues that were identified by focused areas. So the team has really spent last year, and it's not just the emergency management team, that is the whole Pinellas County team. So all of our county departments and all of our partners, looking at how we can make those improvements and what we needed to address. All of these issues have been addressed. Not all of them have been completed because some of them are longer term measures. And I do have a follow-up report that I will be providing to all of you this week, so that way you can see all of the things that we've been able to accomplish. There were 5 major areas that were addressed in the after action report. So the alert and warning, evacuation, reentry, healthcare facilities, sheltering, communications and critical infrastructure, and debris management. These were the key topics that were identified that we wanted to particularly focus on. There were a lot of behind-the-scenes issues that were identified as well that are more emergency operations center, behind-the-scenes type of operations that we don't necessarily talk about to the public, but those are all things that support. So there's been a lot of time and effort in working on that as well. So in relation to alert and warning, one of the issues that happened during Hurricane Irma was with the tremendous demand of people now suddenly looking to see whether or not they're in a hurricane evacuation zone, the Know Your Zone site crashed. So we have moved this over to Amazon Web Services to be able to meet any peak demands that may come in. We have a billboard emergency alert system. So we are engaging, we have 11 partners right now to be able to display emergency messaging at our billboards along the road. So whatever we can do, so as you're going to CVS to maybe pick up a gallon of milk or maybe get your hurricane supplies, we've got that information and those messages out there to remind people, hey, it's time to start getting ready for the storm.
Mm-hmm. That's a great idea.
Last year, we had a tremendous event that we partnered with Duke Energy and Meals on Wheels, and we provided 1,000 storm kits to some of our elderly folks. And this kit included flashlights, first aid kit, ponchos, hand sanitizer, and obviously our county all hazards preparedness guide, and a hot meal out there to folks. So again, we're trying to get out there to our vulnerable populations, try to help them get as prepared as possible. And if they don't have the means to be able to help themselves, try to get them onto our special needs registry so that way we can help them as the storm is approaching. Residential healthcare facilities and hospitals. So we are responsible for reviewing their comprehensive emergency management plans. We have a number of facilities that may have to evacuate when we have a storm coming. So it's very important that we look not only at where they're going to go, but how they're going to get there. And we will be doing an analysis of that transportation because we want to understand at what point potentially there could be problems with that transportation providers and what type of resources we can pre-identify now to be able to support that. We reviewed 325 healthcare facility plans, and this includes the emergency power plan that was put in place after Hurricane Irma. As you know, the tragedies that happened in Broward County with the persons that died because of heat exposure in the nursing home. We want to make sure that that doesn't happen here. So all of our facilities are required to have those emergency power plans. Our Hazard in Healthcare Conference we sponsored had educational modules to be able to help these facilities get prepared, talking about everything from their power plans to strategic national stockpile, stop the bleed. There's a lot of information that we provided. We had over 170 people that provided that conference, and that was put together by our own healthcare coordinator. She took the lead for that, and this is a regional effort to plan. And she also helped raise funding to support the conference both last year and for this year. So whatever we can do to support our partners regionally. Just want to give a shout out to them today. So we actually have 12 medical facilities in Pinellas County that are engaged in an exercise as we speak. They're looking at how they can handle the surge for the hurricane. So the very plans that we talk about for them, how they would accept these folks coming in from other facilities, they're actually practicing that today. That exercise is actually a regional exercise. So we always want to make sure these folks are prepared. Our special needs registry. So this registry is for those folks that may need transportation assistance or may have medical needs, and we need to make sure that we account for them during disasters. We, before the Irma hit, we had approximately 2,300 people on the registry. As the storm was approaching and people realized that this was going to be a threat, we had another 2,700 people that called in for assistance. As you can imagine, that's quite a scramble for us to try to get all these resources to help all these people that we didn't know that were out there, but we suspected it. So we are going to continue to work on educating and trying to get additional people registered in advance. It was very cumbersome during the storm. They had to take the applications via phone, and they wrote the information down on paper. We now have an online system, which is an expedited registration form. It's a shorter form, and that will also allow us to do the triage and make the assignments for the most appropriate facility for them to go to and identify if they have transportation needs. And then we also geocode our folks so that way we can make sure that we're getting them transported appropriately. Sheltering is always a challenge, and as you know, as the storm surge areas increased a couple of years ago with the new models that came out from the National Hurricane Center, it reduced the number of facilities that we could actually use to shelter people in. So we continue to work on additional sites for shelters. I'm happy to announce that the partnership that through the Lealman Exchange is that Lealman Exchange will be online as a risk shelter this year. We're working with real estate management now to assess the capability and size of a generator that is needed there, and hopefully working to get that online. We're also working with Lealman Fire District, who's going to help us give us personnel to staff that site, and then we're looking at a couple of our private nonprofit agencies to help support feeding at that location. We will continue to look for additional sites throughout the year. We trained over 70 personnel from our amazing Human Services Department to help us staff our shelters. So this is a real challenge for us in terms of getting folks to the table to be able to help us support all of our shelters in that staffing. We created an electronic general shelter registration form, so that way once people come into the shelter, we'll be able to register them on site, and this will help us to be able to do wellness checks afterwards. It will also help us be able to look at that information and then better gear our outreach efforts and understanding in terms of who are the folks that are coming into shelters, what their needs are, and that way we can make sure that we're focusing on them in our outreach. We also were successful in securing over $500,000 in grant money from multiple sources, and this helped us to be able to establish a regional Tampa Bay initiative for recovery. They have, since the money has been secured, they've been able to hire an executive director and a volunteer liaison, which was one of our previous interns. And these are the folks that are going to really help us with those long-term recovery needs, especially for the folks that kind of fall through the cracks. So currently they're looking at the impacts of Hurricane Irma, and they're helping families with the needs that they have. So whether it's roofs that they couldn't get repaired through insurance if they didn't have it, or they weren't able to get individual assistance, the Recover Tampa Bay initiative are the folks that are going to be there to really help those folks that are struggling long-term recover from disasters. So what are we doing moving forward? So one of the things that was identified in the after action report was the need for us to have more outreach campaign materials in additional languages. So we are increasing materials in Spanish. We are taking our hurricane guide and we are translating that full guide into Spanish this year. We'll be printing out 20,000 copies of that. We will be reprinting our condensed Vietnamese language guide to get that out there. We are working with the Office of Human Resources and the Council for Persons with Disabilities to look to see do we have the most effective means in terms of communicating information, relaying information? Are there things that we could be doing differently with our outreach materials to be able to make sure that we are getting information to the populations that need us most? We are embarking on an outreach campaign to reach the mobile home parks. So as you know, mobile home parks are extremely vulnerable to the high wind events. So whether it's a tornado or a hurricane, we want to make sure that these folks know where to go and that they have resources for them. We're going to be working with PSTA in terms of doing an educational video to let them know that free transportation is available for them to be able to get to any of the shelters that are open. So we want to make sure that people know there's a place they can go and they have support to be able to get there. We continue to look at community sites and work with the school board in terms of identifying maybe some potential additional sites that we could use for risk sheltering. That's going to be an ongoing process that we'll continue to do. We are doing Alert Pinellas campaigns in conjunction with marketing and communications, again, to try to get as many folks to be able to sign up for that as possible so we can get the alerts right to their phones, get it in their hands, so that way they know that they need to take some action. And for the special needs program, we are looking at programs that will help us with routing and transportation needs. So if you get that influx of 2,700 calls 2 days before the hurricane hits, how do you route that? How do you get the transportation needs that they have and get them to the right place? We continue to work with our partners in the region for evacuation. So with a hurricane, we saw this with Hurricane Irma, all 67 counties in the state of Florida were at some stage of evacuation as that storm was coming. So if you really want to cause gridlock on the roads, that's a tremendous problem. So the communities that were south and to the east of us were evacuating before we were even thinking about it. We actually were hosting evacuees from South Florida here in Pinellas County, and then all of a sudden, as the storm started to move, now those folks had to try to go somewhere else. So it's really important that we maintain that communication and coordination with our regional partners to make sure we can maximize our efforts. Internally, we are looking at our process for our plan reviews and updates. We want to make sure that our plans are up to date and that we're working with our community partners as we include information and our collaboration. So we're not making any assumptions, we're identifying any gaps, and we're able to address those as we move forward. We are currently working with partners to identify a mass casualty incident plan. So the mass casualties, unfortunately, can go long beyond the time when the victims have been removed from the site. You could move into family assistance centers and family reception centers that may go on for months, depending upon the magnitude of the event. Those are plans that we are currently working on addressing. And internally, we are also developing an emergency support function 5, which is our planning. So our planning that we do in the Emergency Operations Center really sets the tone. It helps us be able to gather information through situation reports and to put out those needed incident action plans to guide people as we move forward in the process. So those are just some of the things that we've been working on. Again, a tremendous pleasure to be here working with this team. Does anybody have any questions?
Commissioner Welch.
Thank you, Madam Chair. Kathy, welcome aboard.
Thank you.
Great presentation. Just a couple of questions, and you touched on a little bit, but again, referring to our award-winning budget document, you've got a performance measure in here of shelter space, and you've got a 72% target for shelter space. Are you familiar with that one?
No, sir. I'm
Okay.
sorry. No. I can look into that and address that. Jill?
So the question is, maybe y'all can come back, what does that represent, the percentage of shelter space that we need to have for what type of event? Is it a Cat 3, a Cat 4?
I believe
what
our
does that
deficits
number mean?
occur right now at category 4 and 5.
Okay.
And then what we've actually done with some of our numbers is we've reduced the square footage per person to try to squeeze folks in, because we want to make sure that we can get them out of harm's way. So that's why we continue to try to look for additional sites to be able to put folks in.
So just looking at that number, we have 72% of the space that we would need.
For a category
that
4
kind of
and 5.
event.
Yes, sir.
And I guess when you all look at that, is that factor in the Lellman Exchange space or not?
The Lellman Exchange will give us, I believe, about 500, capacity for about 500. It's not a big facility. That's why some of the schools are better for us, because they do have that larger capacity. They have the open space, they have the feeding capability. So that's why this is a challenge for us. We continue to work with Pinellas County Schools and engage in conversation with them in terms of any of those schools that right now that are outside of the surge areas, that if they're coming up for construction or reconstruction or rehab or anything, can we find a way to be able to work with them to try to get those online as shelters?
And the final question, just would like your opinion on it. We received an email from a constituent who was adamant, and this was before the tornadoes happened a couple of days ago, that, having the digital, the iPhone-based emergency notification is fine, but he was advocating for a physical tornado siren. And then he wrote back after the Alabama tornado a couple of days ago saying, this is exactly what I'm speaking of. Do you have any opinion on that?
I do believe that the sirens do make a difference, and they're commonly used in the Midwest and the West. I think it's something that we would have to look in terms of our capability to kind of have that type of system here in Pinellas County. We do have 290 mobile home parks, so that's a real concern for us, and that's part of why we want to engage in that education for them so they know what to do.
Okay. I'll forward you that email
Thank you.
and copy Barry on it. Did y'all receive that one too? Okay, I'll forward it. Thank you.
Commissioner Long?
Thank you, Kathy. Well, you had big shoes to follow, and it looks like you hit the ground running, so thank you for your presentation today. One of the things that I've been deeply concerned about since Irma is the lack of planning for things like fuel and gasoline in our filling stations and water and the evacuating and then getting people back in here after the event, because we didn't have enough generators, number one. The Emergency Management Center over in the center part of our state, for the state of Florida, ran out of water. They ran out of generators and all kinds of other essential items. And so, given the amount of unbelievable construction that's going in with our roads, that whole gateway area, the new construction on 102nd going towards the interstate, this is a potential for a real catastrophic mess in the event that we would have to get people off this little peninsula this summer, for example. And so I'm just wondering if your folks are considering all of those issues that are new to us since Irma, just because of the lay of the land.
Yeah.
Something to really think about.
Yeah, these are the types of things that keep me up at night. It is a tremendous worry when we see construction, we see increased density in our already most dense population. You know, how do we help these folks get prepared, especially because we have an influx of a lot of people that come from other areas that are not familiar with hurricanes. You know, so yes, these are all things that we look in our planning, and we will continue to address. You know, but we do need to look at that as new developments come in. You know, right now, there is no mechanism for emergency management to build shelters. We have no funding for that in emergency management coffers itself. So when there's new development going on, you know, how are we looking to get these developers to help us to be able to have places to be able to put their folks safely? You know, are we making sure that the transportation network, as it's being developed, can it support the need for evacuations? And we will encourage people to evacuate tens of miles, not hundreds of miles, because we don't want them to get caught up in that gridlock. It's a concern that even though the storm may be projected to go a certain way, Mother Nature will sometimes turn. And the depth and breadth of a hurricane can be hundreds of miles. So even though you may not be in the cone, you think you moved out of harm's way, but you could still be in harm's way. So we don't encourage people to evacuate hundreds of miles because we are concerned about that gridlock and people getting caught there. The increased development is a concern because we've got additional populations coming in that may not be prepared. So we will continue to, you know, work with our partners in our planning to try to address these factors. You know, but we also need the public to be able to help us with their preparedness measures too. Them knowing whether or not they're at risk and may have to evacuate, them having a plan for where they will evacuate if they do have to evacuate. You know, getting our businesses and our other partners to do host homes. You know, how can we help one another in this situation? Getting our agencies, our home health agencies, we have a large elderly population here that receives assistance. So they're getting the Meals on Wheels, they're getting the home health care on a daily basis. How do we get those partners to be able to come to the table and help us during a hurricane? So they're not shutting down and going home because, you know, we're an office of 13.5 people. We don't have those resources to support them. So we have to get that community engagement, get everybody to come to the table to be able to address these very issues.
So and then I have one more, Madam Chair. So you probably know, I know you haven't lived here a long time, but last year there were 5 new big resorts that opened on Clearwater Beach, and they have another 2 that are coming online. So when you have those hotels filled to capacity, on top of the folks that live here, now you're talking about another huge layer of population that has nowhere to go because they all flew in from somewhere else. So these are very big, serious issues that we really need to keep in the front of our brains as policy people going forward.
Yes, and tourists are a vulnerable population. You know, they're coming from outside. They don't have the resources that we have here locally. You know, they're here to have a good time and play on the beach. They're not thinking about, oh, a hurricane is coming or a tornado might hit. You know, they're not thinking about what supplies do I need, how do I get out. So we've already engaged the Chambers of Commerce and the Visit St. Pete, and we're going to be doing some outreach presentations to our our service industry. We would encourage our visitors to evacuate early when they see that storm coming. Get our hotels to be good partners and encourage those folks to go home. So their memories of Pinellas County are amazing. They're very happy to be here. They're glad that someone took care of them. The last thing we want is for those folks to get stuck here and to go through the disaster experience. So we will be working with those partners to try to convey that message and what we can do to help, help people want to come back to Pinellas County again.
Thank you. Thank you very much.
Okay.
I do have just one comment, since you brought up hotels. The hotels were great partners after the storm in keeping people from having to flood the shelters because they didn't have air conditioning, and a lot of the hotels, because they had power, opened up rooms to the community for significantly less than it would have cost, because that's where I was put up for 14 days. So a whole lot of, the hotels are really great partners. And so when you look at a lot of that stuff about shelters after the fact, the hotels are great partners, and I don't think we talk about the partnerships with the hotels after the storm, and they were really, really great. The other thing, and it probably is the wrong presentation, it's probably for Mr. Fogarty, but I wanted to ask him that, and I do think it's for him. It's about the mapping. I know the fire department does mappings of buildings. Are those maps digital, so if there is a tornado or if there is some kind of emergency in schools and stuff like that, are those maps digital so they're easily accessible? I know the sheriff had brought it up when it comes to school safety plans, that the maps, yeah, I know the fire department does maps of every single building, but are the maps digital where they're accessible in emergencies?
Good morning again, Jim Fogarty, Safety and Emergency Services. Some fire departments do have digital. Most of the maps that are on our computer-aided dispatch are PDF formats, so they're available to the response vehicles, and in order to push them out, they had to standardize the format. But the agency that creates them, for instance, Pinellas Park Fire Department, I believe they do have digital versions. I'm not sure if every fire department has digital versions, but they're presented to the CAD system as PDF files so we can push them out to the response vehicles.
Is every school digitized?
I do not know if every school has a map, but I do not know if it's digitized.
Thank you. Thank you, Madam Chair.
Well, welcome. Thank you for doing your first budget presentation, and we appreciate everything that you and your staff are doing.
Thank you so much.
Okay, thank you. We're going to go ahead and do marketing and communications, and then when we're finished with that, we'll take a half-hour break.
Good morning. Still, I'll try to keep it brief. Barbara Hernandez, Director of Marketing and Communications, and I'm super excited to be presenting today on the journey that has been this last year for our team. And I would like to introduce Brian Durr. He is our new Digital and Audiovisual Services Manager, and he has been a wonderful addition to our team. But first and foremost, I want to recognize all of our team, and I have a nice photo of all of them. And some of them are in the back today, some of them are here in the room, and some of them are on the field. So we have a very dynamic team, and this last year has been really significant for us because we have fundamentally transitioned the way in which we conduct our business to become a strategic operation. And I'll explain what that means. So our mission for Pinellas County Marketing and Communications is to deliver communications that empower our residents and that build trust in Pinellas County government. So we see ourselves as the link between all of the good things that are happening at the county and all of the great residents that we have in our community, and how do we take all of that work that we're doing and we translate it into stories that are compelling, into facts that are important that people will want to listen to because they are sometimes life decisions that they have to make. And so the information that we provide, whether it's during an emergency or during blue sky, is equally important for them. So we are 27 FTEs, or just over 1% of the county administrator's workforce. Our services are very diverse. There are many ways in which we engage our community, and so some of them are listed here. Public information, we do community engagement, of course, customer service support, graphic and digital design, audio and video production, public meeting access, which is what we're doing today, and broadcasting. So if we go into a little bit more detail, One of our critical roles is providing emergency and on-call public information response. So we work very closely with emergency management and with all of our other departments. So we have a 24/7 operation. If something needs to be put out to the community, there's always somebody on call that can help get those messages out. We coordinate a regional public information network that is made up of all of our municipal partners as well as some of our local agencies that have expressed interest in being part of it. And what we do is we meet quarterly and we talk about issues that are of relevance to our community, and we share resources. So if we have a campaign, we'll email it out to all of them, and that just expands the reach of our message. So it's a really, really good resource that we have here. Media relations, of course, we do that on a daily basis. We're getting calls all the time from our public information, our media partners. We do public education campaigns, the community outreach, the multilingual communications, and social media management. Additionally, we provide information desk support, so when people come to the courthouse in the lobby, they find either one of our friendly staff faces or a volunteer that we helped get to guide them through this building. We provide live chat support, so when people are on the website and they've been on a page for a while, our staff is monitoring and they can say, hey, how can we help you? And they help them get the information that they need. We also operate the main county phone line, so when people call the county, they get to one of our staff members who can direct them to the right place. We provide this, which is our public meeting support, and I so appreciate our staff in the back that helps us deliver these meetings every time. PCCTV operations, of course, we have a studio back in our facility, and we've transitioned some of the ways in which we use it, and we're now offering tours. So we've had some of our local students come over, look at our technology. We talk to them about the changes that we're doing and kind of how technology is changing with the times. And of course, our field and studio production. And then lastly, printed and digital graphics, audio and video productions of all sorts. We create web content. We have specialized staff that does 3D animation within our building, and photography. So when I got up here, I talked about the journey that has been this past year, and any good communicator will tell you that any project starts with research. So this previous year, we decided to take a step back and look at our entire operation and see what things were going great and what things could we do better. And the first thing we did is the research. So we looked at the Citizen Values Survey. We look at it every year, and we see what our citizens are saying based on, what are the topics of high importance to them. We looked at our department project history. We have every project for years tracked. So we looked at where our services were going. We got senior leadership feedback, so I met one-on-one with each one of our ACAs to get their thoughts on what are we doing, how can we do things even better. We met with department staff, we did a department director survey, and very exciting, we did a team strategic retreat. So we have great wisdom in-house, a lot of historical knowledge. So we all got together and we talked about our department and how can we improve our services. So based on all of that research, we adopted a strategic communications approach. So to explain it in, simpler terms, typically when you think of, I need to communicate with the public, the first thing that comes to mind is, oh, maybe we need a brochure, maybe we need a flyer, oh, maybe we need a webpage. So what we're doing now is we're asking our clients, before we even go there, what is the problem that we're trying to solve? What is the behavior that we're trying to change, the knowledge that we need people to have, or the attitudes that we need to help modify? And so we start with the end in sight, and then we work our way to there. So first the research, and then the tactics. So by adopting a strategic communications approach, here are some of the things that we did. We have the regional PIO network. So we meet regularly with our public information partners in the community. Well, we could be doing the same thing. We have a lot of staff in our county that talks with their residents, public works. They do their outreach. They do their public meetings at utilities when they're having big projects. So we established an internal communications committee, and we're going to be meeting regularly and talking about what is the county communicating and how can we all work together better. So what that's going to bring us is stronger partnerships and increased coordination in-house. We are also, I'm very excited to share that we're developing training programs that our team is going to be leading. I'm going to talk about the media relations program that we restarted this year and going out and talking to all of our staff about how to conduct media relations. But we just piloted a public speaking workshop last week, and it went very well. And we're seeing how the services that we're providing are increasing staff's confidence and preparedness to engage the public. We created a template for strategic communications plans. So again, before we go into need a brochure, need a website, what are we trying to solve? So that helps us stay focused and really target our audiences. And let me go back real quickly. We implemented what we're calling an annual communications project pipeline. So we looked at some of the best practices that some of our peer departments are doing, and for example, the portfolio approach that we now have at the county to manage CIP projects. And what we created is a project list that basically says for this year, as a county, these are our top communications priorities, and we're going to focus on those strategically versus just letting everything just come to us as it evolves naturally. We're going to be more organized. We're going to have a better plan. But of course, we also have to look at ourselves and how can we change things internally so that we can support this new strategic communications approach. So I'm very excited to share that we created our marketing and communications data dashboard. And what that is one central location where every month we store all of our data. How many social media followers we gained, how many people did we reach with our news stories, how many placements we got, how many people walked up to the information desk. And by having everything in one central dashboard, we're now going to be able to look at trends better and make better decisions about our services. We also created a performance scorecard. So we're leading by example and establishing our own measurable objectives for what are we going to consider success at the end of the year. What are the things that we as a marketing and communications department need to be doing to ensure that we're strategic and we're moving the needle? We implemented a project management software that's called Proof Hub, and it helps us track our projects in a much more centralized fashion, and it allows us to give access to our clients so they can see and comment on where we are in the different stages of a campaign. We also created program area guidelines and templates to facilitate some of the day-to-day communications that don't need a strategic communications plan, that just need to get out the door. And we implemented, and a lot of credit goes to Brian, more of our creative brainstorming and planning sessions. And in just a little bit, I'm going to tell you what that looks like. All right, so just some high-level accomplishments for the year. Emergency communications and public information. Red Tide response was a big deal for us. Very quickly, we saw how different departments were connecting. And so we called a conference call. We got everyone on the team, and we said, how do we need to message this? How do we communicate it? And I'm very excited to share that the feedback that we got from our media partners, because they saw all of the coordinated efforts. We were putting out a daily Red Tide update to all of our media partners. The media response was very favorable. The coverage was very positive because they saw that we were on top of our game. And so that gives you some of the numbers. We had over 50 media inquiries, over 50 daily reports. And we were very successful in our public information on the website. We had information in English and in Spanish. You're very familiar with the Amendment 1 public education campaign. We were successful in sharing information with our residents. And one thing that I wanted to note that's of interest is in Pinellas County, the yes vote was 54%, which was 6 points below the 60%. And that was a greater gap than statewide. And our regional public information network coordination. One other thing that we've started doing too is over the holidays, we bring in a guest speaker. So it's not just us always talking to ourselves, but we bring an expert from the industry who talks to us about crisis communications, latest research, who helps us stay on top of our game. Community engagement, as you know, we support a lot of events and we reach thousands of people on the ground through events like Pinellas Citizen University, which is again starting next week. The Leilman Exchange Open House, that was back February of last year. The Rainieri Community Park dedication and the Farm Share distribution events are just some of the events that we support throughout the year. One example of how strategic pre and post measuring goes with campaigns is we did the State of the County Chamber event. So we received an invitation. We could have just gone, set up, and do your presentation, but we surveyed the people who attended the event, and we asked them, did this change anything about your attitude toward the county? And 100% of the survey respondents said that they now have a better understanding, more confidence, and optimism in their local government. So you see how we're taking something that could have been just another event, and we're actually showing the ROI, or the return on investment. What did that accomplish for us? And there's Commissioner Welch. One of the things that's really critical for us that we're working on very heavily this year and moving forward is strategic community partnerships. And Barry and I have had a lot of conversations about this, is how do we get ourselves in a place where we are more proactive as issues start coming up through the department chain. Residents are maybe not so happy about a project, or they don't understand something that's going to be coming down the pipe. So now we're building stronger relationships with our departments so that they give us a heads up. Hey, this is coming, and we already know that this group of residents has concerns or isn't sure what's going on. And so we work with them, we create a strategic plan, and we reach out to those residents, and we inform them before anything even comes to the board. And you can see some images here. This is from the Save the Tides neighborhood meeting that we attended a couple of weeks back. Again, we surveyed the residents, and one of the key outcomes was that they appreciated the fact that staff was very cordial, very informative, and they felt that questions were answered. We had over 250 people here.
So, Madam Chair, may I interrupt? Great presentation thus far. I can't commend you enough for the work that you're doing, so thank you. I know how hard you work. My question, and this may be something that we might need to talk about at our workshop, but given that I live in the Seminole area and we currently have 3 golf courses that are just losing their minds, the folks that live around them, about the proposed development, is it possible to work with the communications team, Barry or Barbara, I don't know who wants to answer this, to do something that educates citizens about the fact that everybody has rights and there is a process? There seems to be a general consensus within some of the community that all they have to do is contact their county commission and we can just say no.
Right.
Do you know what I mean? Like, I know our staff is planning on getting together to talk about a way in which to communicate with folks, but I don't know, it just seems like there must be something more proactive that we could be doing, because this isn't gonna just be located in just Seminole. I envision
Correct.
we'll be dealing with this issue for quite a while.
You are correct in that. We did target to have a discussion around land use and particularly golf courses as a topic, for a workshop. But in response to your specific question, we are already looking at getting out and talking to the residents in Bardmore and preparing some kind of public information. That's actually what they did with the tides. I think it was very well received. To your point about land use rights and explaining both sides of that, we can talk about what's before us, but each area is going to be a little bit different about whether there's development rights underneath it or not. But yes, we certainly can, and that's one of the things they've been working on. And we've been trying to work with the departments to kind of identify these topics earlier, make sure that we do something more proactive. But I think even on the communication, with technology now, the idea that their team is kind of looking at is using that technology to improve road projects. I mean, there's many ways people receive information, so it's there to be able to, and I think people expect information more instantaneously, that there's going to be a road project, it's going to be a road closing, it's going to be, down to lanes, and they can do a lot more working with the departments to be real strategic in the way we communicate, not just putting information out for the sake of putting information out.
I just think there are worlds of opportunities out there, so it's kind of like guaranteed.
We just have to ask our kids how they communicate, and then we'll know, right?
Yeah. And to that point, actually at the Tides meeting, that was one of the opening messages from staff was, this is what we're here to cover, this is what you should know before we go into any discussion about the particulars of your area. And I think the community appreciated the upfront, candid approach. This is the boundaries within which we're talking. And they appreciated that, and they reflected it, those who completed the post-survey. And speaking of research and knowing how we get to people, one of my favorite things is educating the general public. Well, educating the general public is like spraying. So when we are looking at campaigns, we're trying to get away from, let's educate the public. No, let's look at one thing that we can call a success a year from now, specific. And if we can show that we change knowledge, an attitude, or a behavior, then we can demonstrate that we were effective versus putting out 100,000 brochures and not even measuring or knowing who got them or if they even wanted them. So we're doing a lot more targeted outreach through digital, through social, and sometimes in person. You have to have those face-to-face conversations.
Good, thank you.
So I think I've pretty much covered this slide already, so I'm going to go ahead and move on to the next one. Just real quickly, as it relates to media relation, we accomplished over 200 online placements. We're looking for the next year to be able to measure on broadcast, so on TV and radio, how we're performing, and there are tools out there that help us do that, so we're going to be looking at that. So this is strictly online placements. We restarted our media relations training program. Our goal is to have all of the departments have at least one training session offered this year, and we're doing newsroom visits. I wanted to include a slide on customer service. I already talked about it, but just so that you can see the volume of services that we provide to our visitors on the courthouse, more than 20,000. We had almost 10,000 calls handled on our main line, and you can see that we're also supporting the public records request routing. Graphic design and photography, just wanted to note that we served over 40 clients, both internally, and we have some partners like Forward Pinellas that come to us and work with us on some projects. And one of the things that I really wanted to touch on, and you can see it in our presentation that is being displayed, is this past year we took on a look at our brand. We hear a lot about our logo. We hear a lot about how we're putting out our graphic design. And we took a step back and assessed our brand. And we have right now, a very good thing, over 90% trust and confidence from our residents in Pinellas County. What that tells us is that we have a very strong brand, whether we might want to tweak something about the logo or maybe a color. So what we did is what we call a branding refresh, which is without changing fundamentally our brand and our logo, how can we make it better? And so what you're seeing is a transition from an example of a slide that has all these gradients and red lettering, which is not necessarily the best way to project information when you broadcast it on TV. What we're doing is we're making it more intuitive for the reader so that information they can see it faster. So it's a branding refresh. We've been piloting it with our PowerPoints, and it's been very well received so far. So we're anticipating continuing to roll it out in our letterhead, in our name badges, so that, again, it's clear for people to see information when they look at it. We have a very strong brand, and we wouldn't want to compromise that by all of a sudden deciding to get very creative.
Good. I like that.
Video production, just real quickly, just on YouTube we had over 460,000 minutes of watch time, and I thought that was interesting to explain it in different terms. So that's the same as somebody watching our YouTube channel for 320 consecutive days.
Oh my goodness. Whoa.
For broadcasting and production technology, and I'm going to try to be quick because everybody wants to go to lunch. The one thing, other than the HD, the high definition upgrade that we completed in this room, the one thing that I really wanted to point out, and this is all credit to our great staff, is Ed, he's our broadcast engineer. With our team, they built a live production system that you can take on the field, and it's high definition. And what it has done, and it's been tested, it's taken our post-editing work down from 12 hours to 1 hour. So now our videographers have more time to continue working on other projects that they have on their list and spend less time editing, because when we go to an event, they can live direct it, live switch it, so to speak.
Can I ask a quick question on that? I know you're trying to wrap up. So if someone is watching our live streaming, in terms of video quality, is it HD quality that they're seeing like on their laptop or computer?
It is high definition. We send the signal high definition, but our cable companies are standard F. So we have to down convert our signal.
So even if it's on a laptop or a device?
If
other
you
than-
have it on a device, it should be high definition, and like if you're on YouTube, you can select which quality
Right.
you want. But if you're watching it on TV
on
at
te-
home,
Right, I knew that was
Yeah.
a problem, but if they're watching on a device,
yep,
like a,
as long as that
phone or-
device can take that quality of the signal, you should.
and I know other governments have the same problem. They've got all this HD equipment, but if you're looking at it on your cable television feed, it looks like 1960s. So, any progress talking with Spectrum or?
No progress to date, but we continue to have those conversations, and we actually, Brian and I just met in it a few weeks back, and we're picking back up that conversation because we keep trying.
Okay.
Well, maybe you can teach them how to do it. Just saying.
Things that come out of the blue that we're happy to support, Supervisor of Elections, when they were doing the election recount, they had an audio issue. Our staff jumped in, and over the weekend, that's Dan right there, was able to help get that signal going and the media get the audio that they needed. And social media is going really well. We've had growth across all of our platforms. On average, it's a 20% growth if you look at all of our different platforms. And the one thing that I wanted to highlight from there is that we're doing a lot more faces and videos. So we're putting staff from different departments out so people can see that we're human, that we're doing our work. We're just like you. We're getting things done. And that's just showing the different growth. Instagram had our greatest audience growth. It was over 40%. Youth mentoring is important to our staff, so there's different ways in which we engage with our local students. We've reached over 100 kids this year with Pinellas Promise, which is our summer youth education program, and we actually expanded it to a second location this year, so we have it in Lilman and in High Point. We've already done the recognition for Penny for Pinellas up here before and for Hurricane Irma, so I'm going to go ahead and skip over that slide, but a lot of hard work, good work. And the most recent one, we just found out that the APWA, the American Public Works Association, is going to be recognizing our team, not just our, but the county team on the red tide response, as well as our team who worked on Move Safe Pinellas, which is a video series that we have on social that we're doing with Public Works. And it's been so successful that now local stations, local TV stations have picked up that video stream and have showed it on their live broadcast. And then moving forward, we're going to continue implementing our strategic communications approach. We're going to be working heavily on our new website. We're going to be doing some testing with our residents and stakeholders once we have the new structure in place, and that's going to take, of course, several months to get ready. So more to come on that. We're going to continue with our media relations training, our multilingual community engagement, and we're going to be finalizing some studio and master control upgrades that are part of this high definition transition. And I said it was a journey. It started with our residents, it ends with our residents, and I always like to give you some quotes, some colorful quotes that we get. So you can see some of these here. For Farm Share, Joe writes, "Thank you all so much for this event. My 92-year-old Mima was very happy with the food bag." On the Move Safe Pinellas, we did a video that talked about Halloween safety, pedestrian safety. And Huron writes, "Great video. Thanks Pinellas County for providing families with this great tool to share with our kids." So we're doing it one post at a time, but again, I'm really happy about the work that our team is doing and the support that we have to really be a strategic operation. Thank you.
Excellent. Good job.
Very good presentation, and we do want to thank your staff for a lot of the proactive outreach that's been done, you know, in your marketing efforts, especially the Red Tide, the Penny. We know you all were working overtime over the last year or so, and we really appreciate it.
Thank you.
Commissioner Justice.
Thank you, Madam Chair. Can you talk a little bit about how you differentiate? I mean, there's a flood of information, and you've got departments, and you've got the public awareness stuff, and you've got so much things. How you divvy up how much of that you share, because it can be too much. And then also, and maybe this is for Brian, but how you decide what's going on Facebook, what's Twitter, what's Instagram, or is it just flooded on all three? And how you differentiate which, and YouTube, you know, which gets the full video, which gets the 15-second, or do we just flood everybody with everything? I mean, I'm on Nextdoor, and it used to be a great place for local, actually very local information, from garage sales to lost pets to what restaurant was opening, but it's gotten flooded with the city that I'm in, I'm flooded with city of information, whether it's in my neighborhood or not. They just flood it completely. So if you just kind of talk a little bit about that, because I love what you're doing as far as the strategic communication part.
Yeah, and very high level research. We look at each platform, we look at trends and how people are consuming information there, if the demographics are changing every year. We look at how they adjust their policies. So Nextdoor has very strict policies, and we're very judicious in how we use Nextdoor, because we will know if people are upset that we're blasting them with information. So we do that research, and then based on that we determine this is really good for social, but it's not good for a news release. And we're actually trying to get away from the mentality that everything is a news release. Sometimes we get the request, news release, news release, news release, and it's like, well, again, what are we trying to accomplish? And based on that, we decide, well, this is really social media, or this is really, you need to have a meeting with these people. So it takes a little longer to be strategic and analyze what you're doing, but it helps us be more effective.
Very good.
Excellent.
Okay, thank you very much. Okay, we'll take a break and come back about 20 till 1.